Great. Well, good morning. This is a meeting of the Board of Supervisors. We have already started this special session today. We had an executive session and we have adjourned that session, and now we are going into our regular session of the Board of Supervisors. The first item that we have is a proclamation. This is consideration and possible action to approve a proclamation celebrating April 2020 as County Government Month. And I'm going to have Supervisor Ryan have the honor of reading that proclamation. But first, I'd like to ask Eric Peterson, Director of Public Affairs, if he'd like to make any comments about this item.
Thank you, Supervisor Archuleta. For those watching on the stream, my camera will load shortly here. Thank you for the opportunity. Supervisor Ryan's going to read the proclamation. As we have been dealing with COVID-19, April is County Government Month. And as we've been in the midst of this response, I just want to commend our entire county team for their response to the COVID-19 pandemic in Arizona. Public health matters are a matter of concern and matter of statutory duty for the world of the county government. And so it's just timely for us to celebrate the role and the work that we are in as an institution of county government at this time. And with that, I'll turn it to Supervisor Ryan.
Great. Thank you, Eric. Supervisor Ryan?
Okay. Thank you, Madam Chair. And thank you, Eric. You're copying some of the thoughts I had. This is a time, especially under emergency, that you truly understand where government is a critical piece of keeping community together, and we're all working hard on it. And I also place my compliments out to staff. I'll go ahead and read the proclamation, and it's a Coconino County proclamation celebrating April 2020 as County Government Month. Whereas the nation's 3,069 counties serving more than 300 million Americans provide essential services to create healthy, safe, and vibrant communities. And whereas county public health agencies across the nation are playing a critical role in responding to the COVID-19 pandemic by providing accurate and up-to-date information, offering critical testing, securing personal protective equipment for healthcare providers, and keeping their communities safe. And whereas there are 15 counties in the state of Arizona collectively responsible for and serving the needs of every resident of this state. And whereas the counties provide benefits to shape how communities grow and are vital to boosting Arizona's economic competitiveness by constructing infrastructure, maintaining roads and bridges, resurfacing projects, providing land use and economic development policies, maintaining public safety, providing health care, administering justice, keeping communities safe, maintaining strong national defense, maintaining trained emergency responders, running elections, maintaining water and sewer improvements, and other public activities. And whereas Coconino County takes pride in our responsibility to protect and enhance the health, personal welfare, economic welfare, and safety of its residents in efficient and cost-effective ways. And whereas Arizona counties reflect a wide diversity of people, culture, and landscapes of our state. And whereas in recognition of leadership, innovation, and valuable services provided by the state's counties, now therefore we do hereby proclaim April 2020 as County Government Month to recognize the impact and contributions of Coconino County and the dedicated public servants that strive each day to enhance communities within the county. And I move that we approve the proclamation. Do we have a motion? Do we need a motion for a proclamation? I probably should check that.
Yes, we do.
Okay, so I'll make that motion, Madam Chair.
Thank you. Is there a second?
I will second it. This is Supervisor Parks.
Okay, we have a motion by Supervisor Ryan, a second by Supervisor Parks, and we'll have let's take we'll go ahead and vote on the motion, and then we'll take comments. All in favor of the motion, please say aye.
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 Any
Aye.
opposed?
Okay, thanks.
Opposed, please say aye.
Okay,
Seeing none opposed, the motion passes. So just before we go on to comments, I just want to let somebody know that we can hear you in the background. So just a reminder to all of the folks that are joining us this morning for the meeting, if you would please put your devices on mute. And then when you're ready to participate, then we can go ahead and have you unmute. Otherwise, we'll be privy to your conversations, and I don't think you would like that. Okay, thank you so much. So let's talk a little bit about this incredible proclamation recognizing the service that county government provides. Is there any member of the board who would like to speak to this item? And you just need to take yourself off of mute. Supervisor Ryan, you said you had some comments. I don't know if you are on mute, but you're welcome to take yourself off of mute at this time.
Thank you, Madam Chair. Actually, I already provided comments before the proclamation, but it's worth reiterating, and it's captured well in the proclamation, especially that very long, I'm going to brag. Did you hear me read that very long whereas in there with everything the county does? But it's amazing. When you work with county government, there are many aspects to community that people depend upon us in order to help out. And so it's at these times when we're under an emergency that it really makes a big difference to have that support for the community. So it's really good that we have this proclamation and we pause for this moment for county services. And somebody does not have their mute on out there. Thank you, Madam Chair.
So thank you. So I'm getting quite a few messages saying that the general public does not have audio. And people are saying that perhaps we're still in executive session. So I don't know if they have the correct connection. I'm going to, let's go ahead and proceed while Eric and others troubleshoot this. We'll proceed with any other comments from the board. And if we do not have it troubleshooted, we'll take a quick recess and to make sure we can let other people into the meeting. So are there other comments about this proclamation recognizing April 2020 as County Government Month?
Madam Chair, this is Lena.
Yes, go ahead, Lena.
Lena Fowler. Yes. Thank you. I just want to really appreciate this proclamation because of all the things that right now with this pandemic, you know, the news out there is talking about health and how everything that is being done on this pandemic that is going on. But what they don't mention, it's the counties they're the ones on the front line trying to manage. We're the ones with the EOC that is set up. We're the ones that organize and communicate with the healthcare providers, our own communities. So I think it's really important that this proclamation, you know, we do have to have people recognize all the things that we do as a county, all the different departments and all of the you know, planning that we do for our county. So I just want to appreciate that. Thank you.
Thank you, Vice Chair Fowler. Any other members of the board that wish to comment?
Madam Chair, this is Supervisor Parks.
Yes, go ahead, Supervisor Parks.
Yes, I would like to say that I really appreciate all the county workers, folks that are out there when we are not in the office. They are working from home or they are working from Public Works, or they are working from emergency management. And these folks, and the healthcare workers as well. These folks have carried the water for this county for this entire COVID-19 operation. And I want to say that I appreciate them all, and thank you very much.
Thank you, Supervisor Parks. Supervisor Babbitt, do you wish to comment on this item?
I'm good. Just echoing Supervisor Parks' comments on this. You know, our work continues to go on. Just so appreciate people being nimble, committed, and dedicated in a pretty tough time. So it's super appropriate. Thank you.
Thank you, Supervisor Babbitt. And I just want to just commend all of the staff. I mean, extraordinary times call for extraordinary leadership, and really want to appreciate the leadership of our county managers, of our department heads, of the Board of Supervisors, and the leadership that's taken on by every member of our team, all of our county team during this time. And you've stepped up. We continue to provide services to the public, albeit in different platforms via technology. And but we are still meeting the needs out in our community, and that's a source of pride for me and for all of us. And so thank you very much for your work, and we are very proud to celebrate April 2020 as County Government Month. So now we're going to go on to our next item, and I know the majority of the folks that are have joined us for this particular item. I want to just let you know that if you have not joined us by Teams, you need to, if you want to participate in the meeting and hear the meeting and attend the meeting, you need to join us by the Teams function. And so if you look at the agenda, there is instructions at the top of our agenda of how to join by Teams. You can join through the phone by Teams, or you can join using your laptop, your computer, your tablets to do that. I'm going to turn it over to Eric to give the instructions on, if you have a question, what you need to do, so that we know that you have a question after the presentation is presented. So Eric, can you please tell everybody what function to use to ask a question?
Certainly. Thank you, Supervisor Archuleta. This is Eric Peterson. I'm the Public Affairs Director. First of all, for those of you, we can see for everyone who is attending here, we have about 153 attendees, and then about another 40 between the phone and our presenter queue. So we just have about 200 people in our meeting today, for everyone's information. The on the right side of your screen, there is a little bubble chat box, and it has a question mark up on the top. If you click that, that is a Q&A page, and you will see a couple moderator comments from me. You can post a question in there, and we will publish it when it is the appropriate time to answer questions and ask questions. Or you can email comments to boardcomments@coconino.az.gov. For folks that may be having trouble with audio, we are troubleshooting. We are not sure. It might be a link. You might have gotten the wrong link forwarded to you. We are working to correct that and make sure that you can hear, but we are getting reports that people that have joined through Teams and clicked the live link are in the live meeting and hearing the audio, and I can hear it on my personal account as well. So we think we're right. We'll try to correct it and make sure to drive a right link to you if you are having problems. And then Supervisor Archuleta, just one final thing. For those on the phone, I'm going to start muting all of you, so don't be surprised. But to unmute because we have muted you, press *6, please, when it's an appropriate time to ask questions. If you are not presenting, please do not take your phone off mute. The chair will call for questions when there's time for the public to ask questions. Is that correct, Supervisor Archuleta? Is that the way you want to proceed with that?
That's correct, and then you will help moderate that so that we'll get an indication from you if you would like to ask a question, and then we will call on each person to do that.
That's correct.
Okay, great. Well, thank you. So for those of you who had trouble joining us in the beginning, I do want to tell you we did have our executive session this morning. We adjourn that executive session. We just started with our regular meeting, our special session. We just finished the item number 2, which is the proclamation of Coconino County Government Month, this month, April, and now we're going to our discussion items. The first item on our discussion agenda is discussion update from Deputy County Manager Incident Commander Dr. Marie Peoples and Northern Arizona University regarding the novel coronavirus, COVID-19, and response efforts. And so I want to wish everybody a good morning and thank you so much for joining us this morning. Today's board meeting demonstrates the deep collaborations across organizations. In Coconino County, we are fortunate to have a world-class academic institution in our backyard, Northern Arizona University. NAU has a long and storied history of collaboration and innovation. NAU continues to have a profound impact on Coconino County, creating over 19,500 jobs for residents in our community and representing over $1.96 billion worth of economic activity across the county. The economic impact extends beyond Coconino County, with NAU accounting for the creation of 24,000 jobs across Arizona and contributing over $2.6 billion in economic activity across the state. And while their economic impact is considerable, it does not reflect the degree to which the university improves and enriches the lives of the students, the staff, and the community at large, contributing a richness in depth and diversity to our local community. The programming that the university makes available to the public provides an exciting opportunity for our citizens to experience something new, and the research contributions of the scholars at the university has inestimable impact on the academic landscape with every new discovery and publication. As our community and our world at large have faced unprecedented disruption, fear, and loss during the outbreak of COVID-19, NAU's collaborative spirit has shown to Coconino County's benefit. The County Emergency Operations Center activated a full-scale COVID-19 response. During this time, experts with various scientific backgrounds at NAU offered to volunteer their time to support our county response. This partnership deepened when the Center for Health Equity Research Partners agreed to develop a robust planning document to help support and inform the decision-making for us county leaders. I want to take a moment to acknowledge the spirit of partnership from the individuals presenting to us today, as they have volunteered their time and expertise for the benefit of Coconino County. We are incredibly grateful to each individual who has contributed to this crucially important work, and to Dr. Rita Chang, who is supporting their ongoing partnership with Coconino County. At this time, I would like to recognize Dr. Chang to make some comments and to thank her for her support. Dr. Chang?
Supervisor Archuleta, can you hear me?
I can.
Okay, this is Joanne Keene, and Dr. Chang is there, but we were having an issue hearing you. So I'm not sure if you can see her on here.
You're having an issue hearing me or hearing her?
Correct, hearing you. So if Lindsay, I just asked Lindsay to call her.
Supervisor Archuleta, this is Eric Peterson. We do not have Dr. Chang in the presenter queue yet, so we'll work on that. I'm sorry we don't have her listed in here as the presenter, so she may be as an attendee trying to figure that process out.
Okay, that's fine. So I think it's important that we then just take a few minutes to bring her in, and we can just wait for a minute. And I apologize for the technology issues. Obviously, we're all working on it as rapidly as we can, and so I appreciate your patience. And if you just joined, please stand by. We are fixing some technical issues so that we can have our next presentation. So please stand by.
Okay.
Okay, I think we got her.
Thank you, folks, for standing by. We're working on some technical glitches. We should be resuming shortly. Ladies and gentlemen, if you're here on the Board of Supervisors special session for this morning, Friday at 10, I just want to let you know that we're working on a couple of technical difficulties that we're experiencing, and we should be with you shortly. Ladies and gentlemen, if you've just joined, this is Liz Archuleta, Chairwoman of the Board of Supervisors. We are experiencing some technical difficulties. We will work on correcting those. We are doing that right now, and we will be resuming our meeting shortly. Thank you for your patience. Ladies and gentlemen who are joining the Board of Supervisors special session this morning, we apologize for the delay. We are experiencing technical difficulties and will resume shortly. Please continue to hold. Ladies and gentlemen, thank you for being on standby. This is Liz Archuleta, Chairwoman of the Board of Supervisors. We are experiencing technical difficulties. We will resume our meeting shortly. We are working on this as rapidly as we can. Thank you for your patience.
This is Dr. Chang from NAU. Is this coming through?
It is coming through. Thank you.
Yeah. He is in and supervisor are supposed to respond to here, right? Yeah, audio.
Ladies and gentlemen, this is Liz Archuleta, the Chairwoman of the Board of Supervisors. It looks like we are have assessed the technical difficulty and we are fixing it now, and we should be on shortly. Thank you for waiting. We appreciate your patience.
Dr. Cheng, are you on the phone line?
Yes, I'm on. I am on, and I don't want to hold you up, so I can be on via phone and be just fine.
All right, Supervisor Archuleta, I think we are set to go with what we can make happen here.
Thank you, Eric. So if we'll go ahead and proceed, and let me just tell people that we will resume right now. I'm going to just write a message here. And I was receiving some feedback from some folks that said my voice was a bit choppy, so let me know if that happens. Okay, Eric, thank you. And I still see our slide on the screen. Is that what we want to see? Great, thank you. Okay, well, thank you everyone. For those who have just joined the Coconino County Board of Supervisors special session this morning, we just passed a proclamation declaring Coconino County Government Month for this month of April, and many of you were not able to hear, but there were several accolades for all of our staff and for the incredible work that has been done by the county during COVID-19, and of course every single day. And so extraordinary times calls for extraordinary leadership, and we want to thank every member of our team for their leadership during this time and what they do every day to serve the citizens of Coconino County. We are now going to go on to item number 3. And as you know, before we start experiencing technical difficulties, I had introduced this item. I'm going to go ahead and do that again. This is a discussion and update from Deputy County Manager, Incident Commander, Dr. Marie Peoples, and Northern Arizona University regarding the new coronavirus COVID-19 and response efforts. Good morning, and thank you everyone for joining us this morning. Today's board meeting demonstrates the deep collaborations across organizations. In Coconino County, we are fortunate to have a world-class academic institution in our backyard, Northern Arizona University. NAU has a long and storied history of collaboration and innovation. NAU continues to have a profound impact on Coconino County, creating over 19,500 jobs for our residents in our community and representing over $1.96 billion worth of economic activity across the county. The economic impact extends beyond Coconino County, with NAU accounting for the creation of 24,000 jobs across Arizona and contributing over 2.6 billion with a B in economic activity across the state. And while their economic impact is considerable, it does not reflect the degree to which the university improves and enriches the lives of the students, the staff, and the community at large, contributing a richness in depth and diversity to our local community. The programming that makes this university and what makes the programming that the university makes available to the public provides an exciting opportunity for our citizens to experience something new. And the research contributions of the scholars at the university has inestimable impact on our academic landscape with every new discovery and publication. As our community and our world at large has faced unprecedented disruption, fear, and loss during this outbreak of COVID-19, NAU's collaborative spirit has shown to the county's benefit. The County Emergency Operations Center activated a full-scale COVID-19 response. During this time, experts with various scientific backgrounds at NAU offered to volunteer their time to support our county response. This partnership deepened when the Center for Health Equity Research Partners agreed to develop a robust planning document to help support and inform the decision-making for us, the county leaders. I want to take a moment to acknowledge the spirit of partnerships from the individuals presenting to us today, as they have volunteered their time and expertise for the benefit of Coconino County. We are incredibly grateful to each individual who's contributed to this crucially important work, and to Dr. Rita Chang, who has supported their ongoing partnership with Coconino County. At this time, I would like to recognize Dr. Chang to make some comments. Welcome, Dr. Chang, and thank you for your support of this effort and of all of the efforts in partnership with Coconino County.
Thank you, Supervisor Archuleta. Every morning I get up and think that when I come into my office, I'll have in-person meetings and that we will all be together. And then as I get dressed, I realize it's going to be either Zoom or phone calls all day long. And I appreciate that we have some technology that allows us to still connect with each other. And I'm happy to be here today virtually to thank you, Coconino County, for your partnership with NAU as we navigate the COVID-19 pandemic together. I'd like to highlight a few of the key partnerships and contributions our teams at NAU are making to help support our community. As you'll hear in a few moments, the contributions of Julie Baldwin's team at the Center for Health Equity Research in partnering with the county to provide epidemiological modeling for the spread of the virus is really amazing. You also have read likely in the paper that Paul Keim and his team at the Pathogen and Microbiome Institute are on the cutting edge of research into the virus. They recently launched the COVID-19 Testing Service Center to grow the virus and test new drugs against it using the sophisticated biosafety labs and equipment that we have in our campus laboratories and the significant research experience that Paul and his team brings to this challenge. I would like to also point out that Dr. Joseph Guzman from the Alliance Bank Economic Policy Institute is working closely with the county to model the economic impacts of the virus and chart recovery that's so important to Northern Arizona and to Flagstaff. During the initial response to the virus, NAU has contributed nearly 150 test kits to Coconino County to help facilitate rapid testing and response. And we've launched a campus-wide effort to inventory and collect PPE supplies from our labs and other areas to help contribute to areas of high need. And we continue to donate PPE to FMC, the county, and first responders. I'm so proud of our teams in the Library Maker Lab and the School of Informatics, Computing, and Cyber Systems in their 3D printing much needed masks and face shields for healthcare providers. We've been able to use foundation funds so that we can provide those much needed masks and face shields free of charge to both here in Flagstaff and on the Navajo Reservation. And finally, our IT staff is partnering with communities across Northern Arizona to provide Wi-Fi hotspots that will allow students at home, particularly on the Navajo and Hopi lands, to continue their education and provide the essential resource of internet access. Liz and members of the board, thank you for your leadership at Coconino County. Thank you for being a true partner to NAU. I want you to know that NAU is here for you, and together we'll get through this pandemic and emerge stronger than ever. I wish all of you a safe weekend and be well.
We appreciate your support, and we appreciate your support of the faculty who are going to be part of this presentation. So with that, I would like to turn it over to Dr. Marie Peoples, who is the Deputy County Manager and Incident Commander for the COVID-19 response. Dr. Peoples? And Dr. Peoples, you'll need to unmute your device there.
Dr. People, we can't hear you.
Give her a moment. She's going to unmute. Stand by.
Supervisor, Dr. Peoples is unmuted but is having some microphone problems, we see. So that's causing that distortion. So I think we should just move forward quickly. We'll come back to Dr. Peoples if that's potentially possible.
Absolutely. Thank you very much. So I think what we'll do is we'll turn it over to the NAU faculty who are going to be presenting at this time.
Hello, this is Joe Mahaljevic. Are you able to hear me?
We can hear you loud and clear. Thank you.
All right, I'll go ahead and share my presentation. I'm going to share my desktop now.
Thank you, and we appreciate your patience as we're working through these technical difficulties.
Joe, you are live, so feel free to go ahead.
Are you able to see this full screen?
Yes, we are. We're able to see the full screen.
All right, well, I just want to thank the county and our partners, Dr. Marie Peoples and her team at the Incident Command Center, the Incident Command Team for COVID-19, for having us this morning, and we're really happy to be here. Our goals for this presentation and for our research and partnership moving forward are following. So we're really interested in synthesizing data and knowledge to contribute to informed decision-making. We're interested in building lasting partnerships based on trust, mutual understanding, and high-quality research. And we're here to assist our Northern Arizona communities through these difficult times. So today we have two related presentations. I'll be giving the first presentation, and I'll be talking about using data and models to estimate how the novel coronavirus might spread in Northern Arizona, and how might this impact our regional hospital systems. The second presentation by Dr. Samantha Sabo and Dr. Ricky Camplain is presenting our work in developing a data-driven public health plan. Where do we go from here? So I'm going to be discussing forecasting the impact of the coronavirus across Northern Arizona. And I really need to thank my collaborators, which is a rich team of computer scientists, infectious disease experts, and public health experts. And we really appreciate all of the partnerships that we've been building with the county and across other counties in our northern region. I just want to start my presentation with giving a data snapshot of where we are right now. So down here on the bottom axis, we have time, and the data points represent the cumulative number of recorded cases of COVID-19 across 4 counties of Northern Arizona. So we have Mojave County, Coconino County, Navajo County, and Apache counties. And we can see that the situation is a little bit different in each county, but it's really important to understand that we need to work together to understand how COVID-19 is going to affect our regional hospital systems that treat patients regardless of what county they reside. And so here's some data that's sum across the counties. So this might be data that you're used to looking at. So the triangles represent the cumulative cases if we sum across these 4 counties. And then this blue ribbon represents the error in these data due to reporting delays. So we know that it takes a little bit of time from the time a patient might be sampled and tested for coronavirus to when that data might be reported. And so you can see that the cases are continuing to increase across our county and across our regions. The goals of my presentation are to give an update on our efforts to first create a model that describes how the virus spreads and to customize this model to our region in Northern Arizona. We're also looking to rapidly deploy model output for public health and healthcare stakeholders like yourselves. And to do this, we're building a web portal for our partners to engage with our results, which I'll demonstrate later. And we're looking to deploy weekly updates that are refined by data. So I just want to give a little bit of background on modeling and talk about why this might be something we're interested in. So we know that models are useful and models can guide decision making, but models are uncertain. And I want to talk about this because you often hear in the media these days that models are uncertain, they might be giving false perceptions, but why might models be uncertain? The first reason is that no one is an expert on this new pathogen. We're working as hard as we can and as fast as we can across disciplines to understand as much as we can about this virus and how it's spreading in populations. And models are uncertain because we're all human and we're working just as fast as we can to understand this. Models are also uncertain because we're limited by data right now. We need additional data to improve our models so that they can make predictions into the future that are more accurate. But acknowledging the uncertainty, and in the face of this uncertainty, we're forced to make hard decisions that affect people's lives. And we're just saying this because we understand the position that all of the county workers are in right now. You're making very difficult decisions. Our elected officials are in a very tough place, and really here to build partnerships that are based on this mutual understanding. So I want to go over a few useful outcomes of modeling that can guide decision-making and to guide our knowledge of the situation as it unfolds. The first thing we can use models to do is to calculate the pathogen's reproductive number, or R0, which you might have heard about in the media. And so just a quick description of what R0 is. So pretend that I'm infectious. I'm infected with the virus and I can spread it. R0 represents the number on average of how many new infections that I might cause. So how many new people might I spread the pathogen to? So if R0 is greater than 1, that means that I'm spreading that virus to, on average, more than one person, which means that the pathogen can spread in the community. And so R0 gives us an estimate of the speed of spread and whether interventions might be slowing the spread. And so if R0 is less than 1, that means that I'm spreading the virus on average to less than one person, or it could be 0 people. And that means the virus is declining in our communities and populations. And so this picture here gives an idea of the entire USA and how SARS-CoV-2, the pathogen that causes COVID-19, has been declining in the United States. And so here we have the date on the bottom axis, and on this axis with the bars here, we have the R0, the reproductive number. And we can see that early in mid-February, the pathogen had a high R0, which means that it was spreading exponentially across the United States. But then due to public health interventions like stay-at-home orders, we can see that that number has been declining, and that by this time, we can see that R0 is close to 1, which means that the pathogen is still spreading, but maybe not exponentially. But it also emphasizes that it's likely that the pathogen is not declining yet across the United States, but our interventions are working. And I'm going to talk about this in Northern Arizona a bit later. Another useful outcome of modeling is that it allows us to forecast or to predict or project into the future and how this might affect our hospital burden in terms of the number of hospitalized patients, ICU, or ventilated cases that we might expect into the future. And so this is just a graph from a model from Penn State that was developed. And this is just a toy model. It's not modeling any specific population, but you can see how it's useful to understand when we might see peaks in hospitalized patients. Another useful outcome of modeling is that we can use the models to simulate scenarios of interventions. And so I'm going to walk through this figure here that was developed. This is a model that was developed for Santa Clara County, California by Erin Mordecai and her team at Stanford. And so in these two panels, we have time, on the bottom axis, and we have the number of expected hospitalizations at any given time in Santa Clara County. And so what we can see here is that they're simulating cases where up here we have strong social distancing for 3 months. So this is a scenario of stay at home for 3 months, or strong social distancing for 5 months, where this green region represents that time period of 3 or 5 months. And then this red line represents the hospital capacity and how that might be increasing over time as we mobilize to increase our hospital capacity. And then the black line represents the model's projections. And we can see that with 3 months of social distancing, we have a flattening of the curve here for a while as we've slowed the pathogen, and then it increases rapidly after we remove those social distancing measures. And we go from about 2,000 hospitalizations quickly to 16,000 hospitalizations. And again, this is just a projection for this county. But if we have social distancing for 5 months, we flatten the curve even more, and we reduce the total number of hospitalizations that we might expect at a given time, and we've pushed that off into the future, allowing us to increase and mobilize and prepare. And so we're applying all of these modeling approaches to Northern Arizona, and we're really fine-tuning our models to the populations that we have in this region. And so we're building spatially informed models of outbreak dynamics, with the realization that there are few major hospitals that service all of Northern Arizona, a population of 360,000 residents approximately. And so we know that patients are coming to hospitals that are outside of the counties that they reside. So we really need to take a holistic approach and look across the whole region. We also need to realize that our region has high variability in population density. We have some urban centers, but some very rural areas. And some populations are more isolated than others. And so on the left here, we have a map that shows the population density of people per square mile. And this is 10 to the 4th, 10 to the 3rd, et cetera. And we can see that this is just a zoom in of Flagstaff where we can see the urban center that's nested within a more rural region. And we really need to take into account how the spatial variability might affect the spread of the virus. And that's what we're working on with our modeling. And so I just want to give a very basic understanding of what's going on in our model to explain how the pathogen is spreading so that you know where our projections are coming from. And so here we have susceptible individuals that have not yet been infected that can be then exposed to the virus. These individuals go through a time period of incubation where the virus is replicating inside of them, but they're not yet infectious to other people. Then they can move from the exposed class to infectious. And so infectious individuals can be in different categories. So we know that the pathogen can be spread by asymptomatic individuals or individuals that have very mild symptoms, whereas some infectious individuals develop severe symptoms. And our model assumes that it's possible that up to 20% individuals might experience severe enough symptoms to visit the hospital. Now, this doesn't mean that they'll necessarily be admitted to the hospital, but they might visit an ER because they have symptoms that they're afraid of. Then these severe symptom individuals might go to the hospital and they could be admitted. And then all of these individuals can eventually recover and become immune for some period of time to the pathogen. And so in our model, it ends up that about 4% of cases actually visit the hospital, which is fairly in line with what we're seeing in the data across the globe. So the first thing I want to talk about is, have current interventions been working in Northern Arizona communities? And so the take home from this figure, which I'll walk through in a second, is that interventions are working, but there's regional variability in how they are working. And so here's a plot that I showed similar to before, where we have the reproductive number, the R0 of the pathogen, and this is across the 4 counties that I mentioned in our northern region. And we can see that early on in mid-March, we had rapid spread of the pathogen, so exponential spread, but that has been declining over time due to our interventions that we've been implementing across the counties. We can see that there's some variability over time, and some of that could be differences in testing. So this increase here could be that we're able to rapidly test more individuals, which leads us to discover more cases. And so that's really important to understand, is that our understanding of how the pathogen is spread is really limited by our ability to test individuals and get that data as fast as possible. And we'll talk about that more later. But what we can see is that in our region, the pathogen R0 has not yet declined below 1, meaning that the pathogen is still spreading in our communities and it's not yet declining, but we are being effective in our interventions. And here you can see the regional variability in R0 across the 4 counties. And so you can see that in almost all counties, we've reached a point where we've got the pathogen at least moderately under control, but in all cases, we're not certain that the pathogen is yet declining in our region. So the take home from this analysis is that interventions are working, we're slowing the virus, but now we want to understand what happens if we remove the interventions that have been put in place. What if we go back to business as usual? Before I talk about our projections, I need to discuss a common misconception. So you might have heard in the media a lot lately that we have reached the peak or we're close to reaching the peak. Well, what does this mean? The fact is that in disease outbreaks, there can be multiple peaks. If we stop interventions now, the virus is bound to spread more unless we have on-the-ground methods to limit that spread. And Dr. Sabo and Dr. Camplain will talk more about this in our public health plan. So I want to give an example of what I'm talking about here. So easing restrictions too soon can mean that we're faced with the decision of multiple lockdowns. In countries and cities that were very successful early on at limiting the spread of the pathogen, they're recently being faced with the decision to re-implement restrictions and lockdowns because the virus has started to spread again. And so we can see this has happened in previous outbreaks in our country as well. And so let's take the example of the Spanish flu in 1918, where we saw multiple peaks in the epidemic. So these data that I'm showing are from Denver in 1918, and I'm going to walk through this rather complicated figure. So down here, we have the date, and on this axis where there's the data, we have the number of excess deaths due to the 1918 Spanish flu compared to the normal strains of influenza that were circulating in previous years. So you can see that they've got their first case in September. They applied interventions as those cases started to rise. And then you could see the effect of interventions because they started to flatten the curve. The curve started to peak and then started to decline. And as that curve started to decline and the pathogen was being reduced in the population, the interventions were removed. But because the pathogen still existed in the population and some people were still not immune to the pathogen, they hadn't been exposed yet, then you had this rapid increase in deaths again because the pathogen started spreading again. And so this is an example of seeing multiple peaks of an epidemic. So we want to simulate future scenarios for Northern Arizona, and we have to calibrate our model by comparing it to data. So I just need to introduce you to the data that we're using to try to understand if our model's doing a good job at forecasting into the future. So we've seen these data before. We've got the number of cases over time in the 4 counties that we're interested in. And so we see that that's increasing. We also have data on the number of new hospitalizations or new cases per day and the hospitalization data on the patients that have visited the hospital. So here on the left, we have new hospitalizations per day. So we can see that the new hospitalizations are increasing. And what I mean by hospitalizations are new discovered cases, because I'm making the assumption that most of the cases that we're discovering right now are because these individuals are going to a healthcare facility, which is the majority of cases that we know about right now. Here we have on the right, the patients currently in the hospital or that visit the emergency department each day. So a data point here is the sum of regional hospitals. And so for each day here, it's the number of people that visited the ER that were COVID-19 positive and the number of inpatients that have COVID-19 in the hospital. And so there is still a problem with our projections that we're limited on data. we really don't have spatial data on a lot of cases across the different counties, but this is really important for our model and something we're working with the counties to collect these appropriate data. And Coconino County has been really great in assisting us with this. And what this leads to is that there are several potential outcomes or forecasts of our model that could be better or worse that currently match the trends in the data. And so that means it's hard to distinguish which outcome is most likely. In other words, we still have high uncertainty, but we're still going to show the possibilities because our model is matching the data quite well. And so the first scenario that I want to show is, what if we remove all restrictions on May 1st? So this would be 45 days of stay at home and then immediately return to business as usual. So first, we can understand how our model is matching to the data. So the triangles are the data that I showed before on the cumulative number of cases that have been discovered in the region. And then this dark yellow line, the heavy line, represents the average of our model projection. And then these light yellow lines represent error in our model as it's run multiple times. And so we can see that the model is matching up well to the data. And so that gives us more confidence in our model projections. And so the first projection that I want to show is an optimistic projection and one that might be a bit more likely, but again, we have high uncertainty. And what we're making a strong assumption of here is that the low population densities and spatial isolation of some of our communities in the region might slow and reduce the spread of the virus. Again, this is an assumption, and it's also predicated on the assumption that we have on-the-ground efforts to then find those cases that emerge and isolate them so that they reduce the spread. And so what might we see under these circumstances? So in this optimistic projection, we see a second peak after May with 3 times the number of hospital visits that we see right now. And so here again, the black dots and triangles represent the data that we have, and the yellow represents our model. And we can see that based on the early data, our model is matching to the data quite well. And then we see the projections into the future. And this dashed line represents when we might remove the interventions if we remove them on May 1st, and we go back to totally business as usual. And we can see that there's this second peak of new hospitalizations per day. So per day, we might see up to 100 new hospital visits, or we might see 300 individuals in the hospitals in our region per day. So there is a less optimistic scenario in which we make the assumption that the virus quickly reaches every corner of our region. No matter how dense the populations are, the virus is able to reach those populations because of travel between regions. And so this is a scenario that's being modeled in cities, and it represents the scenarios that are really advertised in the media. And so I'll go through that. And so even in this less optimistic scenario, we still see a good match in the early time period. So this is our model versus the data, and the model, even with this less optimistic scenario, is still matching the data. So again, we're struggling to differentiate what the most likely outcomes are. And if we look at the projections, if we remove all interventions on May 1st, we can see that we see a second peak in the outbreak, with this time 20 times the hospital visits. So we go down from here where we have less than 100 up to here where we have 2,000 individuals across our region that have to be hospitalized in mid-May. And so again, this is less optimistic, but not outside of the bounds of reality. And if you recall, this model from Santa Clara County estimated a similar increase where you remove interventions and you go from less than 2,000 hospitalizations up to 16,000 hospitalizations. So what if we remove all restrictions on May 31st, 2020, which would be 75 days at stay at home? So in the optimistic case where we have population density that's helping us out and reducing the spread of the pathogen, we see that the second peak is actually smaller than the first peak. So we have an outbreak that starts to decline up to June. We release and go back to business as usual, and we see another peak, but it's small. And so again, this is optimistic, but it gives us an idea of how having interventions for a longer period of time can really help us out and reduce the spread of the virus. In the less optimistic projection, we see a peak in mid-May, which is in line with a lot of the models that are out there right now. And then that pathogen starts to decline, but we've only declined a little bit into June, and then we release and we allow people to go back to business as usual. And you still see a large second peak, but this time it's with 10 times the hospital visits rather than 20 times. And so that additional 30 days of intervention really helps us out. And so these are a limited number of scenarios where we realize that there's been a lot of discussion recently about how should we open up? Should we open up gradually? How long should we have these interventions? And so we've created an interactive tool to play with our model and to simulate alternative scenarios. And we're working with public health folks to come up with scenarios that our elected officials might actually implement. And so I'm going to stop sharing this screen and share another screen to show the interactive tool that we've created. So just give me 1 second here. Okay, so I hope you're able to see this screen now. And so this is an interactive tool that we're developing for public health and healthcare stakeholders. And so this is what we're calling the Collaborative Response Network for COVID-19 preparedness across Northern Arizona. And we've got a little blurb here, and users can log in. So right now this is specifically made for public health folks, but we can open it up to other interested parties on the Board of Supervisors, for example. We log in and we see a little bit of information about our model that we're producing, which we're calling spatial resolution sensitive models of outbreak dynamics. And then if you go down here, you can view the interactive model. And so we get some instructions where we can change some of the parameters of our model and run the simulation and see what happens. So here we have the % contact reduction. So the interventions that we're implementing, how much do we expect that to reduce our contact among human beings? And so let's say we've got 60% contact reduction, which is similar to what we're estimating. We can change the length of intervention days. So I didn't show you if we go for 100 days, so I'll click that. We also build in movement of individuals in our model, so we can have local movement primarily where people tend to stay close to home, or we can have regional movement where they tend to travel further. And then we have frequency of movement. So how often do they move to different places? And so you can have low, which is under our stay-at-home orders, or maybe something that's more close to normal. And then we can run the scenarios like I talked about where we do or do not account for population density. So for now, I'm just going to say don't account for population density, which is the less optimistic scenario. And then I'll just run my simulation. And so we can see that figure that I already produced, which has the cumulative cases. And then we can look at the model projections. And so here is what I showed before if I rerun the model, where we had a peak in May and then that declines and then we release interventions in June. But then if we do the same model, so here we had 900 cases in the hospital. But if I do that with 100 days of intervention, now our second peak is down to about 300, so down from 900 to 300. So we can play around with these situations and see, and so public health stakeholders can see what might be the case. And so I need to switch my screen one more time to go back to my presentation, and I'm just about done and we'll hand it over to the next presenters. And so moving forward, we're looking for additional data streams. We really need to understand the locations of early cases across the county. So across different counties so that we can build that into our model. And we've requested these data from ADHS, who have approved the data request, but we haven't quite gotten the data yet. And so we've established a collaboration between counties to try to collect data. And ideally, we would know which cases, which individuals are sent to which hospitals, so we can build an understanding of which hospitals might be most stressed under these times. And we're really interested in building collaboration and partnerships with our tribal nations. And moving forward with our modeling, we're really interested in building mapping functionality so that public health stakeholders can isolate different areas and see what our model's projecting for different cities or rural areas in our region. And so with that, I just want to thank you for your time and pass over the presentation to Dr. Sabo and Champlain.
Thank you very much. Dr. Sabo, you are next. And if you can share your screen, we'll get your presentation up.
You got it. Thank you. Oops, hold on just a second. Let me just check this real quick.
Sure, of course.
Can you see my screen yet?
I was able to a couple of seconds ago.
Okay.
And it was clear.
There we go.
Yes.
Great.
Excellent. Thank you and welcome.
Thank you. Can you see it as a full slide now or not yet? Just trying to do multiple. Still there?
Sure.
As a full screen?
No, we can still see the slides on the sidebar.
Okay.
There we go.
Okay. Yeah, learning technology is always fun. So I appreciate everyone. Thank you for your time and this time to be able to share with you the next presentation, which is trying to get at really what do we do with this information and how can we move forward. So thank you all for having us today. Myself and my great colleague, Ricky Champlain, will be presenting this piece, and we hope to have a robust conversation after we get done. So I just wanted to let everybody know that Ricky and I are both part of the Center for Health Equity Research. This is a newly established center at NAU under the direction of Dr. Julie Baldwin. And I can't tell you how often I go back to our mission and vision to be that trusted partner and leader in research and action. This is truly the time where this vision and mission guide us, and we're so grateful to be here with you all today. Today, this side of the presentation will really focus on sharing some of the cutting edge science that will enable us all to make data-driven decisions about how to move forward and how to transition us out of the more strict social distancing efforts that everyone has worked so hard to put into place to reduce the risk of transmission and hospitalization of our community members. So we'll remind you of a recent report that we completed. We'll try to describe for you the phases of the COVID-19 pandemic, and we'll really focus on this phase 1, which is this idea of slowing the spread. We'll try to give tools to everyone on the call about triggers for lifting social distancing. How do we know when we can move forward? And then we'll lastly talk about those thresholds for transitioning to phase 2, which is around reopening state by state. This first slide is just a snapshot of the recent Coconino County coronavirus response report that we completed at the request of Coconino County. This is the table of contents for those folks that are on the phone. We will make this widely available to you. We're very proud of it. The report summarizes the epidemiological data and recommendations to support public health officials and local government to navigate the rapidly evolving COVID-19 epidemic in our region, and specifically provides data on Coconino County. The data and recommendations presented are those available at the time of preparation of the report. As Joe just wonderfully displayed, this is rapidly evolving, and those of you on this call who eat and breathe these numbers each and every day know how fast things change. So we hope to share this information widely with our county partners, tribal partners, to be able to use. Can you see my little, I have my pointer here. I wanted to draw your attention. I think the most useful part of this report, which we hope to share soon, is a group put together an exhaustive list of evidence-informed guidance for slowing the spread of COVID-19. So we tried to provide the known evidence by sector to be able to present that, and folks can use it to be able to make decisions in their own place of business, in their own work. We try to include most of the sectors, both essential and non-essential businesses. We try to provide and find guidance around indoor and outdoor entertainment, employment and labor, childcare, schools and universities. We try to provide that guidance on how to mitigate COVID-19 in the transportation sector, public safety and law enforcement, correctional and detention facilities, and the list goes on. So we just wanted to make sure that you'll all have that. Some of you have it in a report, but we'll make that more public. That report was prepared by several folks from NAU in deep collaboration with the county, and I just want to give a really shout out to our undergraduate and graduate students in public health who really have stepped up and taken on this challenge and have had the opportunity to learn in real time what public health is. But before we start the presentation, I just really want to, and in honor of the proclamation that was made at the beginning, dedicating the month of April to county employees, this work is absolutely in tandem and in deep coordination with the Coconino County COVID-19 Incident Command Team, which involves several sectors. We work with a small section of folks, and we are especially grateful to Incident Commander Dr. Marie Peoples, who has really guided us and tasked us with stepping up and making data available in real time. We are severely grateful to the surveillance group and the investigation and monitoring groups that have taken us in, taught us everything they know, shared data, and helped us be part of their team. And we know that they are working extremely hard around the clock and doing all of the work every single day. And lastly, just the frontline health providers and the health systems leadership. Without their continual provision of data, these models that Joe just excellently presented would not be available to us. We couldn't make these projections, and we couldn't do the public health planning that the Incident Command Team is so dedicated to doing. So we just wanted to appreciate you all. So to start the presentation, I'll give you an overview of the phases of COVID-19 pandemic. I wanted to draw your attention to a recent report that I am using, and we are being guided by, produced by Dr. Scott Gottlieb and Caitlin Rivers from out of Johns Hopkins. Dr. Gottlieb is used to lead the FDA, and he is an excellent public health expert and researcher and policymaker. This report is called the National Coronavirus Response, a Roadmap to Reopening, and it provides detailed guidelines based on the best available science to guide federal, state, local governments to know the triggers or the metrics which we need to meet to begin lifting the social distancing measures that Joe just talked about and that we're all actively engaged in our homes right now, as my son just scurried around underneath my table to get something. According to the report, there are 4 phases of this pandemic, and we are currently in phase 1, which is called Slow the Spread, as you can see on the screen. And That is the phase that we will focus on today, and I'm sure this isn't our first or last conversation about this topic as we move through the phases of this pandemic. So what is slow the spread? We all are experts now. I know you all are shaking your head saying, I know what this is. As Joe's presentation helped us understand, until we have pharmaceutical and medical interventions that can protect us and effectively treat COVID-19 through vaccines and those types of measures, which are pharmaceutical based, we are using a variety of public health interventions that create social and physical distancing to reduce the spread of the disease and flatten that curve. We do this to avoid overwhelming our health systems and our healthcare providers, and we do this to prevent serious morbidity and mortality from COVID-19. And I think pausing here just to take a breath and to recognize that all of these measures that everyone is engaged in, and our leaders on this special session are having to deliberate over each and every day. I just want us to be proud because these interventions are working, and we're together as a community saving lives and preventing COVID transmission. So that is public health, and that's why I love what I do, and I love working across all of this, all of the teams that have been put into place to get this. So take a breath, stand up. I know we've been on Zoom calls all week long, and just recognize that the work that everyone is doing is working. So that idea of flattening that curve, using non-pharmaceutical interventions or public health interventions to try and decrease the spread and not overwhelm our health system is working. So what we want to focus today, Ricky and I, is looking at those triggers for slowing the spread. So we want to just level set a little bit because oftentimes and in the media, we don't know why a stay-at-home advisory is implemented. And so there are thresholds that we're going to start to work through together today. So according to the report, The Road to Reopening, I mentioned earlier, which is in direct alignment with known science and has been picked up by many other areas like Santa Clara, California, which was one of the models that Joe showed, which is the epicenter of the California pandemic. They use this model to identify the four triggers. And so at the stay-at-home level, which we are in, and Governor Doug Ducey implemented on March 30th, the trigger for that is when new cases of COVID-19 are doubling every 3 to 5 days, or when the state or local officials decide to put a stay-at-home advisory because their health system is at capacity. And so as Joe told us, and we saw in the data, and as Supervisor Archuleta let us understand, we are a region and we are interconnected in so many different ways. And these case counts depend not only on our county, Coconino County, but on our region and our neighboring counties and tribal nations that we all share. So going back to that report, the 4 areas, the 4 phases in phase 1, the triggers for lifting social distancing, or the metrics or the triggers or the thresholds, however you want to, the check boxes that we need to check off to be able to transition away from physical and social distancing as our primary tool for controlling the current and future spread of COVID-19 are 4. I wish they were 3, but we're in a new world now, so everything is 4. So your magic number is 4. So we're going to go through each of these, and we're going to show you data that you all can access and think about whether or not we've met these triggers. So the 4, for those of you on the phone and can't see the screen, the 4 triggers are a sustained reduction in cases in the state for at least 14 days. That's 1 incubation period, and we want to see those cases going down over a period of 1 incubation period. Hospitals in the state are safely able to treat all patients requiring hospitalization without resorting to crisis standards of care. That is another trigger that has to be met. The state is able to test all people with COVID-19 symptoms. And the last one, the number 4, is the state is able to conduct active monitoring of confirmed cases and their contacts. So those are the 4, and we're going to work through those. So trigger 1, a sustained reduction in cases in the state for at least 14 days. What you're seeing on the slide now is publicly available, and I'm sure many of you are aware that the Arizona Department of Health Services is producing really robust infographics every day at 10 a.m. So every day at 10 a.m. you can roll, in your pajamas or whatever we're wearing to work these days. You can click on to ADHS and find these types of data that I'm showing you right now. And what this graph, this publicly available graph on the ADHS dashboard is showing us is the number of cases by county. So you can see it by the map, by age, by gender, as well as by race and ethnicity, and over time. And this is what we're going to focus on today, is this bar graph here on the right-hand side. And so to be able to meet this measure of a sustained decrease in cases over a period of 14 days, we need to be able to see that in this graph here. And what we see is a lot of peaks and valleys. So the bar graphs go up, they go down, they go up, they go down. And what we really need to see here is that this graph is less peaky and valley and more valley. So, and although these data are from April 4th, when we looked yesterday, these trends are very similar. These peaks and valleys remain where there is not a sustained decrease in cases in the state. As Joe mentioned earlier, and we'll talk about later, this graph is highly dependent on our ability to test for COVID-19. So we may see these numbers grow and get worse. But we know that when we improve our ability to test all people who need a test, those numbers will go up, but that is important to see. So we'll talk more about testing in a minute. This is the same graph that was pulled off the ADHS website, but this is for Coconino County. And so ADHS is getting really slick, and I'm really proud of them. They are working really hard to get the data available and interactive enough that folks at the local level can use and make decisions with. Again, for all of you listening in, and for many of you who live and breathe these graphs every day, ADHS is getting better and better and helping us to do this work. And from a public health perspective, these data allow us to know who is affected most and where interventions could be leveraged better. So currently the data that we're able to see is age and gender, race and ethnicity, as well as geography. And this is important for public health. It's important for us to be able to see where are vulnerable populations and what types of interventions or spaces we can intervene on more quickly than not. So the next slide and the next trigger is our hospital systems and the capacity of our hospital systems to deal with COVID-19 response. And this section will be presented by my colleague, Dr. Ricky Camplain, who is an epidemiologist and working closely with her rock star other epidemiologists, Dr. Megan Warren and Dr. Britannia O'Connor, in coordination with Chelsea Donahue and Matt Maurer at the county to monitor these data over time. So I'll go ahead and turn it over to you, Ricky.
Hi, can you hear me?
Yep.
All right. So to kind of orient you to what we're about to talk about, one way to determine if hospitals are able to treat patients without resorting to crisis standards of care is to conduct surveillance on beds and essential supplies, capacity and availability in our hospital systems. And hospitals have been reporting facility capacity to the state, which the county has access to, and we have received reports twice daily since March 27th from 3 hospitals here in Coconino County. And that includes Banner Page, Flagstaff Medical Center, and Tuba City Regional. And in the report, we have information on ICU availability, emergency department bed availability, and medical surgical beds, as well as the ventilator availability. So on this particular slide, you can see on the horizontal axis the days, so each day since March 27th, and the vertical axis is percent availability of ICU beds. And as you can, and if you see a break, it just means that the data was not reported for that particular day. But for ICU availability for Banner Page, which is in in blue, FMC in orange, and Tuba City in gray, you can see FMC has been at or below 10% availability for their 43 ICU beds most days, which indicates they're very close to capacity. Banner Page and Tuba City fluctuate a lot more over time and may even look better at times when it comes to availability. But since there are so few beds, 3 and 6 ICU beds for Banner Page and Tuba respectively, their availability can change very quickly. Sam, can you go to the next slide? Thank you. So this looks similar to the ICU figure, but this is emergency department bed availability. And you can also see here that it has fluctuated over the course of the pandemic. Both FMC and Tuba City Regional Emergency Department availability has remained over 60% since March 27th. And Banner Page has experienced spikes in low availability of their 9 emergency department beds. All right, next one. Thank you. So on your submitted version, this next slide might not look the same, but for this, in regards to the medical and surgical beds at the hospitals, availability has generally remained below 20% in all 3 hospitals, with little fluctuation at Flagstaff Medical Center and Tuba City Regional. Banner Page again has seen more fluctuation of their 6 beds, and these beds include isolation units, and those have been at low availability and high capacity. All right, last one, or yes, and this last slide here for the availability of medical in the hospitals, ventilator ability has, as you can see in FMC, had a slow downward trend from the end of March, which was about 60% availability, to mid-April at 30%. On April 15th, FMC had 40%. The next few days, up to 55%. From experience in hospitals that we've heard from around the globe, physicians may be modifying, and this is a maybe, the practice standards for intubation for different and this might be why we see an increase in availability, even though we are seeing an increase in COVID-19 hospitalizations. And you can also see from this figure that both Tuba City and Banner Page have reported 100% availability in their 8 and 4 ventilators during the course of the pandemic. And we have seen stories in the news, about serious cases from Navajo Nation and other rural areas that transport to FMC and other larger hospitals in the state and even in our region. So this may indicate that they may not be housing COVID-19 patients that are in need of a ventilator. And to sum up this, these slides, is you might remember from Joe's presentation that if we go back to business as usual, we could get at the very least 100, or business as usual at the end of the month, we could get 100 or more new hospital visits per day. And from this surveillance capacity, that could be extremely burdensome on our already burdened hospital systems. So thank you so much.
Thank you, Ricky. And she and I will tag team these next 2 because we come at it from different perspectives. So our last 2 triggers to be able to move us back to a new normal, I wouldn't say a business as usual, but definitely a different new normal, is trigger number 3, which is the state is able to test all people with COVID-19 systems. So this trigger is met, so testing is the way that public health officials see the disease. So these are our glasses. This is what we need to be able to see what is happening and how to intervene. When we cannot test, we cannot follow up and provide the case monitoring and the disease tracing, which we will talk about in the next trigger. Again, I invite you to look at the ADHS testing data. This is available at 10 a.m. every morning, which, like the other graphs, helped us to see testing by region, by age group, and over time. And so focus your attention here on the bar graph. You can see that testing is going up, which is amazing and important and fundamental to everything that we need to achieve this metric. Yet based on these numbers, less than 1% of the population of Arizona has had the opportunity to be tested for COVID-19. And we know that is too low, as the estimated community transmission rate is around 10% for the state. This is the bar graph of Coconino County specifically. Remember, I told you can click on the county and then get your data. So if there's folks from Mojave and other places, Navajo and Apache counties, you can do this yourself, and you probably do this every day. This is the same graph. We also have been able to test less than 1% of our residents in Coconino County, and we have an estimated case rate of about 19%, which is higher than the state rate of 10%. I'd like to ask Ricky to weigh in if she has any extra tidbits of information about testing, and for some of the reasons why testing may not be occurring at the rate we need to be making to meet at this metric. And I can ask you, Ricky, if you had any other thoughts on testing.
No, I think we'll talk about that on the next one a little bit more in depth, but it really is an important trigger that is hindered by not the people trying to test, but availability of testing materials.
Exactly. So we've heard a lot in the news and on our partnerships that testing just is not as available as everybody would like it to be. We know that we keep hearing testing as something that the federal government is definitely hopefully getting a handle on. Our states and our regions and our universities are innovating incredibly fast to be able to meet this need. And so that is something that is fundamental to be able to move forward. So the last trigger is this idea of case tracing. And this is the state is able to conduct active monitoring of confirmed cases and their contacts. The last trigger to meet to effectively transition out of phase 1 to phase 2 is this basic and fundamental public health function of active monitoring of confirmed cases and their contacts. And so what you can see here is the essential and critical data that is gathered by the monitoring team at Coconino County to be able to understand who the COVID patients are. These are this is essential information to be able to really identify high-risk populations and to be able to better mitigate with more focus. So people in close contact with someone who is infected with a virus, such as coronavirus, are at higher risk of becoming infected themselves and of potentially further infecting others. So by closely watching these contacts after exposure to an infected person, this will help the contacts to get care and treatment and will prevent further transmission of the virus. So these are essential data displayed in this infographic here, collected by the incredible monitoring team at Coconino County, led by Marette Gebhardt, Sabrina Kelly, Candace Conker, and Mary Ellen Ormsby, who have painstakingly trained up our students and staff, about 7 or 8 of us, to be able to do this type of work, to be able to call patients who have been tested positive, as well as and follow them over time to make sure that all of their needs are met, that they have plans for quarantine, that they have plans for isolation, especially our more vulnerable populations who may not have the luxury of 2 and 3 rooms in their home to be able to do this in. And this team is just an incredible group of people. Big shout out to them because they're really helping people make decisions over time, over the phone in a safe way. So this process is called contact tracing, and it has 3 steps, which I can go over or we can kind of move forward. But what is the biggest take-home message here is that the data that's collected over time is useful, and it's more detailed than what you would get from that state data. So if you remember what we saw on the available data for the states, it's just general. We don't know who, and we don't know how. So when we look at this infographic, we see that among the 64 positive cases at the time of generating this that had been followed up with case monitors, the mean age of those individuals was 46. 30% had a prior contact with a positive person. You can look at the racial and ethnic breakdown, which also can lead us as public health professionals to think about disparities that run along lines of race and ethnicity and education and socioeconomic status. And we can look and see, where do people work? So 27% of the individuals who were contacted worked in a high-risk job. In this next slide, you'll see that we can also look at pre-existing conditions. So we want to know, we know that COVID-19 affects those with underlying chronic conditions at a greater rate. And so when we can see very clearly when folks are able to follow up with people about what pre-existing conditions exist for them, and then also talk to them about their symptoms and what kinds of symptoms people are experiencing while during this time. So Ricky, I don't know if you want to say anything else.
Yeah, one thing to really note about contact tracing and surveillance, it's one important, like the most important thing is the capacity to call people and the data quality, but there is a need to have data systems in place to react in real time efficiently and effectively, and contact tracing and the data it produces should be systematic and sustainable if, you know, to have it for long periods of time and also in the future.
Thank you. So we're wrapping up here, and we imagine you have a lot of maybe some questions, but also our time is limited. So we just want to make the case that we unfortunately have not met any of the thresholds that for action at this point in time, but it's not to say that we aren't trying. And the glimmering light that we do see is that the social distancing is working, and that our hospitals, number 2 in the state, are seemingly looking like they are able to move in the direction of being able to treat folks without resorting to crisis standards. So that's the only kind of beacon or sentinel kind of trigger that we can see right now, because we don't have the ability to test all people with COVID-19 systems, and we're still trying to get everybody up trained and the data systems in place to effectively conduct that active monitoring of confirmed cases. So in closing, some of the recommendations, which I have included 4 other more detailed slides that we can talk about later, for moving from phase 1, which is slowing the spread, to phase 2, which is this idea of reopening state by state. I encourage you to read Dr. Gottlieb's report. It's really approachable and easy to read. Are these 4. So we need to maintain the physical distancing. I think Joe demonstrated that really clearly. His modeling is suggesting at least to May 30th to try and avoid any subsequent peaks and not overwhelm our regional health system. Increasing our diagnostic testing capacity. I know that everyone in this county is working on that every day in collaboration with the state, and build the data infrastructure to rapidly share that information. I think that is something that is super key, is to be able to really share that regionally. Number 3 is implementing a comprehensive COVID-19 surveillance systems within our hospital systems. And number 4, which is I think near and dear to a lot of our hearts as public health folks, is really massively scaling our ability to contact trace and to support our community members to self-isolate and quarantine, because those are decisions that have to be made in context and in the support with the support of others. As folks are losing their jobs, as kids are not in school, we are on top of each other in our homes. And so how can we plan best and how can we support our community members to be able to take care of themselves and their families if diagnosed with COVID-19. To be able to move in this direction, we have there are some areas of strengthening that we can do now. You know, we're talking about it, just having this meeting of really better data to identify areas of spread. Joe is doing that. The county and our coordination with all of you all, we are actively doing that. We are trying to get that data shareable and meaningful and returnable. Improvements in the state and local healthcare systems capabilities and infrastructure to respond to this outbreak. As Joe started this, we're in new territory. We've never been here before, but we know how to do this. We do it with fire preparedness, and we've done it with different types of elements, and we need to kind of conjure all of that knowledge and be able to apply it now. But long term, you know, therapeutic, prophylactic, and preventative treatments are what is going to be extremely helpful with us. So these are the vaccines and the ability to test for your immunology and the work that Paul Keim and others around the state are doing to be able to get us in a good space where we can do vaccinations and we can better protect our population that way. So in the meantime, we'll make sure that you get that report so you can also use those examples of evidence-informed guidance for slowing the spread. We really hope that we tried to make it very interactive so you can pop on, you know, use the interactive link so you can go read more, but we've tried to put that all together for you. And we really appreciate your time in listening to us, and we just look forward to continued work because we're in it for the long haul. And my last personal story is when I started public health, I didn't really know what it was. And I came to the University of Arizona as a master's student, and I came in 2002. And this was at the time when federal and state dollars were flowing as a result of the Twin Towers terrorist attack on 9/11. And the money was going to preparedness and to really build our public health and emergency response systems to be able to deal with a biological attack. And very creatively, I was at the Arizona Department of Health Services at the Office of Border Health, and we're working cross-nationally and binationally at the border to be able to do this work. And we were very creative in using those dollars to be able to figure out how we could build the robust systems, data sharing systems, and protocols between the two countries to be able to, and across counties and tribes, to be able to respond better. And I think that we're at that moment again today. This is our moment to really step up in that way. And we're very hopeful that we can be at the table with you. And we just are so grateful for everything that you're doing now. So thank you all.
Well, thank you very much to the NAU team, the professors who presented this report, very extensive, and we want to thank you for your work and for your partnership with Coconino County. I know that I want to open it up to questions from the Board of Supervisors as well as questions from members of the public who have joined us, but I would like to hand the meeting over just for a moment to Dr. Marie Peoples to provide a couple of comments. Dr. Peoples?
Great, thank you so much, Chair Archuleta, members of the board, County Manager Jane, and Dr. Chang. And in the interest of time, I will be brief. I want to express my gratitude to Dr. Kamplain, Dr. Sabo, and Dr. Mihailovic, and all of the others that have worked tirelessly behind the scenes to help us with the data. Among with other things, they've helped Health and Human Services staff and the Emergency Operations Center with so many different things, and some of those were shared, but we'll be forever grateful for the partnership. So what we've heard today is a lot of exciting and thought-provoking data to help us as we move forward with informed decision making. The county, along with many partner organizations, have many critical decisions to make in the near future, and while there's not one clear direction, the information presented today provides a roadmap, and I'm grateful to be part of such a dedicated team. With that, Chair Archuleta, I will turn it back over to you for discussion. Thank you.
Thank you, Dr. Peoples, for your leadership as the incident commander of the EOC and as our Deputy County Manager, and then also with your expertise in the area of public health and epidemiology. It's been invaluable to Coconino County and to the team. I wanted just to start out with a question first, and then I will turn it over to other board members. And so I was very interested in the, well, all of it is very interesting. I want to know if you could give us some examples of the high-risk jobs that were referenced in one of the slides when we're doing the contact tracing and getting the information from people who tested positive for the virus. You mentioned that there was some information that was received about high-risk jobs. Can you give us some examples of jobs that would be in that category?
I can pull that up, and Ricky, if you have, let me pull that up for you. Supervisor Archuleta.
This is Ricky. So that includes, and we say high risk, and we mean high contact with people. So that could be Safeway employees. There's a long list, I'm trying to also pull it up. I'm so sorry.
I have it here. So Supervisor Archuleta, that was around healthcare. So we had 23% are retired, not working, unemployed. 17% of those folks, of all people, not those, are healthcare providers. 6% were working in healthcare, but not in healthcare providers, but were not healthcare providers. 9% of those 64 cases work in construction landscaping, 8% work at the grocery store or other retail jobs, and 8% work at restaurants. 5% were students, and the remainder work in other varied professions. So we'd have to go back and look at specifically the 27% that we're reporting here and breaking them down. But that's the overall where folks were working.
And the high-risk occupations were self-reported, and the high risk was hospitals and included hospitals and schools. And there's also a self-reported question that they ask about, do you work a high-risk job? And that was a yes or no. And so that was also self-categorized as high risk. I hope that helps.
That's very helpful. And then just looking at the population and the disproportionate number of Native Americans that are contracting the virus, are you doing any cross-referencing in terms of health inequities? And I know, of course, it noted, disease and compromised immune system, for example, diseases like diabetes and cardiac diseases, et cetera. Is any of your further research going to be in terms of like cross-referencing health inequities, access to health care, et cetera, and the disproportionate number of our Native American community that has been infected with the virus?
It's such an important and fundamental question. And I think that's something that is near and dear and important to do. And so as these data become available, so just last week, ADHS was starting to report race and ethnicity on their dashboard. And so we can start to see disparity already presenting itself as we assumed it would, given our global trends in those chronic disease and other areas. But I think it's really with the disease investigation that you're really able to also collect it. And so that's something that is priority. And I don't know, Dr. Peoples, and your team, you probably have more of a plan around that too.
Hi, yes, these are things that we've started talking about and hope to engage the NAU team as well as we move further along. And the information that we've heard today will help inform that as well. Mm-hmm. So our plan, Supervisor Archuleta, will be to take all the information that we've heard today among the questions that we've heard and to be able to come back to the board during the next board meeting with some of the responses and to vet out how we move forward.
Mm-hmm. Well, thank you. And then my last question for right now is just really appreciate the various scenarios that you went through and the recommendation in terms of social distancing, the May 30th date that was that was given, and I understand that. I mean, there are a variety of scenarios, but in terms of the social distancing and that May 30th date, I just wanted to dive in a little bit deeper on that. Is that recommendation, and I'll phrase it as a recommendation, but that particular bit of information, would that be, just for clarification, would that be May 30th, so then June 1, going back to business as usual, or the phasing in? Because I know various options were presented, and so I know that there's some, some other states that are saying, they're still going to keep the recommendation, or they're still going to have the restriction of no more than 10 people gathering, into the foreseeable future, not avoiding large group gatherings, prohibiting large group gatherings. And so I just wanted to know if you could just dive in a little bit more into that May 30th date, and what are you recommending, or what are you seeing as the process on June 1?
Hi, this is Joe. I'll field this question. So this is a delicate question, and I know that you, as an elected official, and all the other folks on the call are struggling with this, and I am too as a modeler, especially how to answer this question. But caution is the word of the time, and I think that, so in the model, we do allow business as usual after May 30th, but that still results in a tenfold, or potentially less in the more optimistic scenario, increase in hospital visits over a very short amount of time thereafter. So a gradual phasing would be ideal. That said, just to give some perspective that I didn't quite get to in the talk, but with a pathogen like this that has that R naught value of somewhere between 2 and 3, we're talking about the potential for 80% of our population to become infected. And so without pharmaceutical interventions, we really need to be cautious for an extended period of time. And so the model is assuming that our population densities can help us if we have on the ground, so low population densities could assist with reducing the spread of the virus if we have on the ground methods to quarantine cases. But the issue is then, what if we go back to business as usual and we have tourism with tourists coming in that have the virus and they're starting to spread it to more corners of our population? Those populations will still be at risk of the virus without pharmaceutical interventions. So I just want to emphasize caution, but that just to directly answer your question, the model does assume business as usual after May 30th, and that in the most optimistic case, that doesn't lead to a huge increase in cases. And that's why we put that date, just because we felt like we should.
Mm-hmm. Thank you. Other members of the board, do you have questions?
This is Lena Fowler.
Vice Chair Fowler, go ahead.
Thank you, Madam Chair. I'm just wondering if maybe a model can be run with these scenarios with the economic impact, just to see that the impact economically. And have you thought about that, or are you maybe working on that?
Hi, thank you for your question. This is Joe again. I am certainly not an economics expert, but I should be working with the economics team at NAU, and we can initiate those conversations for sure to get a better sense and to respond to your needs as the Board of Supervisors. So I've written that down, and we'll consider doing that. Thank you.
Thank you, because we have meetings. Our economic development manager holds an economic impact meetings on a weekly basis, and that's why I'm asking. It would be interesting to compare the two. So thank you so much.
Other board members, do you have questions?
Sure, Liz. This is Matt Ryan. So, one of the questions, actually, first and foremost, thank you very much for providing this information. And as noted earlier in the discussion, we're all wandering through, some phase of unknown on what to do and how to do it. And we're trying to rise to each challenge as it comes in. Knowing there's no vaccine out there, it definitely, speaks to the level of caution as suggested. The dilemma that we're in is we need the testing, but currently we don't have the testing capability when we only have 1% of the state and county population that's been tested. So, obviously that's a concern. I know community members in this county and in some of the other counties, well, actually throughout this pandemic, it is that big push of getting antsy or worried about their livelihood, and so a push to swing back. The question that I start to step into, and I don't know if the team has or if it's Marie, but we have the opportunity to use these results to influence the conversation at the state level. Have any of you begun the conversations as it relates to what we have here?
This is Joe, and I encourage the rest of the team to field this question as well. But we have informed the state of what we're working on, but everyone is overwhelmed right now. And so, for instance, we requested data from the state, but as is completely understandable, they're a bit overwhelmed right now. I do believe they have a modeling team from ASU. I'm not totally sure. I haven't been involved in that. But, I think they're aware that modeling is going on, but we prepared a report for the county, but we can certainly share those reports. I prepared a modeling report, and Dr. Sabo and Champlain prepared their public health plan, so we can share those with the state if that is useful. But I encourage the rest of the team to chime in as well.
I think I would defer to the county on this question, because I think it's related to the capacity, a capacity issue that might be better answered.
Hi, Chair Archuleta, this is Marie Peoples, if I may. So in regards to the question, not so much in terms of modeling, but Arizona Department of Health Services has initiated reopening meetings with the chief health officers. And so those will be launching next week. I mean, I believe at this point they're scheduled to be 2 times a week. And so we'll look forward to seeing what the agendas and what the talk and conversation really is. But we will definitely share any of this information to try to help influence the conversation. Thank you.
And along that line, and once we learned that that you were bringing this forward, these were some of our thoughts. We know there's a big push to try and open things up. Our understanding was, while not seeing your results, recommendations might be, a level of looking at our trends and the caution level that we need to take a look at. And seeing what you've provided, it again works in that way. So it's timely that we put this on the agenda right away, but also have the ability to share that with the state, because we do need to help influence the discussion associated with that. So that's a big piece of it. Yeah, that's well. I'll keep it at that for now, but we can see an opportunity here, and we should attempt to expedite the conversation. A lot of that will be on your side, Marie, when you do have those conversations, but maybe it could be initiated even sooner with that. I'll defer to other board members. I've seen a few questions that popped up on the dashboard here. We're wrestling with time, but it'd be nice to answer some questions too.
Absolutely. Other board members?
Madam Chair, this is Supervisor Babbitt.
Yes, go ahead.
Yeah, thanks very much to the presenters and the presenters who we hear from, but there's obviously just a huge number of people and capacity behind them. So to all the folks who make that happen, just really appreciate it. Super helpful. Couple just observations. One, is just amazing how quickly time is changing things. And, you know, we're at April 24th and, you know, data from April 14th seems years old, and it's just incredible the speed at which these conversations are evolving, and so thanks for trying to give us a snapshot in just such an incredibly quickly moving landscape. So I do have some questions on testing, because you know the testing bottleneck and the testing debacle, I guess is the word I will use, is producing a lot of consequences in our communities, and I see this because there is really a lack of ability to get hands on the breadth and scale of our infection rates here. But where it's really having challenges is people, and I'm getting this, people don't trust even the numbers that are coming out. And that's a fundamental shift, is that people are really starting to doubt even the positive numbers. I ran into this in some conversations the other day, when they just don't believe that even the numbers of positives that we're showing are reflective of the tests we do know. And so they're really important public health and community confidence pieces coming out, because we have not been able to test. So with that said, even looking at what the reports we get from the organization on a daily basis and the reports that we are getting from the state are not aligned. We show us testing many more people here than the state shows. And the difference too is that our health folks do not know the number of private tests that are being given, which do not result in a positive. And so I know the governor's executive order mandated private labs report. So the question is why are we not getting those at the county level? What are the issues with painting a better picture so that the actual numbers that ADHS puts out are close to the ones we put out, because they are not. And so, you know, how can we help continue to right size the data that is coming in? And then what will the county's response to the new order by Dr. Christ, which says anyone can essentially go get a test now? What does that mean in practical terms for our drive-through, and what does that mean in practical terms for our testing capacity? And then the final piece, and you can all just weave this in, is there was no discussion on assay or antibody testing. How does that change some of the dynamics of either optimistic or pessimistic models moving forward? Thanks very, very much.
This is Joe. I think I have to defer to Dr. Peoples about the testing capacity, but the last thing you asked about the antibody tests and how that can affect our scenarios, you're correct in that we're making strong assumptions about where tests are coming from. So are they getting tested only if they go to the hospital, things like that? And that affects our model predictions in a pretty hard to understand way. And so those antibody tests would, of course, inform our model and make us able to make better predictions. But I'll defer to Dr. Peoples.
Hi, thank you so much. So regarding the testing, Supervisor Babbitt's comments are spot on. People are very frustrated with the limitations in testing. And just from the county's EOC efforts, we have continued to try to source from every imaginable source that we can. And we have been very fortunate, as Dr. Chang opened her comments with, that NAU has provided some specimen collection kits. University of Arizona has provided saline kits for us. And we've had several private providers within the community that have provided what they were able to. So we've been able to continue moving, but there certainly is a bottleneck in the supply chain, and that has been frustrating to community members as well as to Health and Human Services staff, because we want to test. Regarding Dr. Chris new orders that came out yesterday, and so everybody may not be familiar with those, but it did open up testing. ADHS has since, even today, put out some additional clarification around that, saying that that was not necessarily for public health, but that the testing being open for everybody was meant for private laboratories. And so that's an interesting differentiation that we need to find out more. But regardless, what that says to the public and what the public is reading through those orders is that it is now open for everybody. And so that, the common person reading that through the paper, as they should, it looks like there are more specimen kits within supply, and that's just not the case. So we're continuing to work on our messaging. We're continuing to try to source additional kits and work with our university partners to do so. So I realize that's not a full answer, but we are continuing to try to work on it and to work with ADHS on it, and to hope that we can be included in that messaging in the future before it goes out, so we can be prepared to be able to respond to the community. Thank you.
Great. One quick follow-up. So why are we not getting the number of total tests that are being done by LabCorp and Sonora Quest? I understand we're getting the positives, as you indicated, but we are not getting the total number of tests. And that was part of one of Governor Ducey's executive order. Can you help me understand that disconnect? Because the 1,900 tests we've done here at the county does not include all those tests that come back negative from private providers. So do we have a sense whether that is another 1,000 tests? Do we have a sense that's another 3,000 tests or another 50 tests?
Thank you so much, Supervisor Babbitt. That's a great question. So while that may have been included in the governor's executive order, there's not necessarily any teeth behind it, if you will, to compel the private laboratories to share those numbers with us. And it's not my sense that they're just not sharing. I suspect it's a capacity, and there's not a clear mechanism to be able to share back. I mean, from my perspective, it would be easiest if all of that was fed back to the state health departments, and then those dashboards were updated in that manner. But I don't know if it's 50 tests, if it's 1,000 tests. Again, all we're receiving is the positive. And that's because LabCorp and the other providers, I should not just note LabCorp, but those commercial laboratories, they tend to send those results, negative and positive, back to the ordering physician. So then the onus is on the ordering physician to provide that information to the respective health departments. And as you know, that's just not a simplistic process. So as we move forward with legislative efforts for future years, as we think about what would help with the public health chain, having those types of things as be legislative issues to make that happen would be a great benefit to public health.
Thank you, Madam Chair.
Thank you. Are there any other questions from the Board of Supervisors? Okay. Any questions? Oh, please, Vice Chair Fowler, go ahead.
Yes, thank you, Madam Chair. And I just want to go back to your equity question on healthcare. I think these kinds of studies are so important. We talk about how do we help, how can we assist, and there are a number of areas that I think that we can all support the healthcare industry. For example, with the Native American population, we can advocate to have the Indian Health Services, Indian Healthcare actually receive the dollars that they're supposed to get, and every year they don't get those dollars. They're underfunded, and they're always lobbying to see if they may be able to get the dollars that really the dollars that they need. And I think we can all help out in that situation. You've also heard about lack of water. And although no water is being shut off, all the wells are open, and hauling water is just part of our life right now. And then even there, instead of delivering bottles of water, I think the greater benefit would be to advocate for infrastructure for water system on tribal lands. And as we look at Northern Arizona as a whole, rather than just looking at jurisdictional issues, we can all really look at how we can help each other. This epidemic has really showed us that, we are all vulnerable at one point or another, and that's where we are right now. And how do we carry each other through this process? And I think this epidemic really shows how we are in it together, whether it's with this epidemic or anything else. And that's where I think that we can really advocate. I know the Board of Supervisors is very good at advocating on behalf of issues that really are most important, that really have a positive impact on the residents and citizens of our county. So I just want to point that out there, and I think this study that is being done, I really appreciate it, because we're just wondering how do you make a decision on when to open up? What does that mean? And when you have so many people that are unemployed, when you have businesses that are trying to stay afloat, and what does that mean? How do you make a decision on people's lives and their livelihood and the families when they're really struggling out there? So I just really appreciate this presentation, and yes, I believe we need to take it to the governor and have him make sure that they make the right decisions, and we also need help in making this decision, and I think this is a good presentation. So thank you so much.
Madam Chair,
Thank
if I
you,
may.
Vice Chairwoman. Yes, Supervisor Ryan, go ahead.
Thank you, Madam Chair. Just a couple of things of note, just related to this. We were talking about, trying to interact with the state so that they can see this, but we've all been in conversations. We have the joint city-town phone calls multiple times during the week, and these are some of the questions that those jurisdictions are asking. As their communities they're struggling financially. We have a Verde Valley call that brings all the mayors and managers and supervisors together on that call, and with their chambers. It would be helpful because these are some questions that people are asking, when do you, why, associated with it. So they're very important. I'll just note, and I'm not sure if we're going to get to the questions on the dashboard or not, but one question that was up there, and it's one that we need to think about, is if we do end up having a case, checking in with the sheriff on what his plans are. I know they've already they're already prepared with some of their plans. But it would be a question to ask with the concern associated with the jail itself, and that's one. I don't think we. I don't know if we have that opportunity to answer that right now, but I would hope that we would talk to the sheriff about that one. Thank you, Madam.
Madam Chair.
Thank you.
Jim Parks.
Yes, go ahead, Supervisor Parks.
Oh, thank you, Madam Chair. Well, following up on what's been said, I feel that there is a really delicate balance between balancing our healthcare and our needs for our citizens in the healthcare department with the economic part of this. And I feel really strongly that if we do open everything up on May 30th, and then we get a spike that is unimagined by this model, then we're back in the same boat. The truth is, and I've been saying this all along, that we're all going to be exposed to this eventually, and we're all our antibodies in our bodies are going to have to be prepared to either throw it off or we'll perish. We have many options. A vaccine is pretty much, we've been working on vaccines for influenza for 100 years, and there is no vaccine yet. I think that we need to look at antibody testing, and we need to follow possibly the protocols that helped us to defeat the Ebola virus by using the folks that have recovered from the disease and use their blood plasma serum with the antibodies to inject into folks that are just barely COVID positive or even uninfected. That's in the future. So what we've got now is what we've been doing all along here: social distancing and the PPEs and those kinds of things, face masks, gloves. Anyway, my question, I think, for the panel is, we have patients from Tuba City being transported to other places, Tuba City and Page, being transported to Flagstaff, some even going as far as Albuquerque. Do we have transport figures, and how do they fit into, say, our Flagstaff FMC bed availability figures? If we're bringing patients from Tuba City and Page to free up beds there, is this one of the reasons why our beds in FMC have not been quite as available as those others? A second question that I have, and I'll go ahead and ask it because I assume that somebody's writing these down. Patient positive numbers. Do those numbers reflect who has been released from hospital care? And if they have been released from hospital care, are they considered to be, I assume they're being released to go home. Are they considered to be recovered? And if they're not recovered, why are they being released to go home? I haven't seen any numbers yet on patients who have been released and are considered recovered. Whenever a doctor releases a patient to go back to work and supplies them with a prescription that they can go back to work, that is the doctor's discretion to release them. Are these patients being released as recovered? And anyway, I suppose that's the extent of my questions. I've got another couple more, but they aren't very important. So if I could ask for answers on those, I'd appreciate it. Thank you.
Thank you, Supervisor Parks. Is there any member of the team that would like to take on those questions?
I think I would defer to Dr. Peoples, who might have a better understanding of that situation, or to Ricky and Samantha about movement of hospitalizations.
So this is Ricky. Thank you for your question. I can talk about a little bit about the movement of hospitalizations, very little. In the contact tracing, they do ask whether someone used an ambulance to get to the hospital, and we found out of the 91 cases as of I think Tuesday, 7 had used an ambulance. So that's the extent of the data we have right now. And we don't know where they went, just whether or not they used it. So on our side, the market share of FMC would probably be helpful in terms of the capacity question, but that I do not have. I hope that was a little helpful.
Hi, thank you. And I would just add one additional piece to that, which still may not get to all of Supervisor Park's questions, and happy to meet next week and see if we can get the other questions, including the ones you didn't have an opportunity to ask, and get responses for those. But regarding why are people being released from the hospital if they're not fully recovered, some of that is because the window is the 14 days, which varies, of course, but 14 days has been used as the basic quantifier for the window regarding contagion. And so people that are not sick enough to remain in the hospital, just like any other illness, they may not be fully recovered from. They're stabilized, they're cared for, and then they're released from the hospital, and then people recover at home. I doubt there would be any hospital capacity where someone could stay their entire stay and be completely cured from COVID. So that's part of what you're seeing, Supervisor Parks. Thank you.
Any other members of the board? Okay, well, I know we just have about 10 minutes left, but I did want to take just a couple of questions here from the public, and some people have actually written in their questions, which I appreciate. If you have a question, if you would write it in. I mean, knowing that we probably are not going to be able to take all of them right now, but the Board of Supervisors will have all of those questions available. And as we meet next Tuesday and continue to meet, these questions will certainly inform our deliberations. So there's a question that says, it seems like your models are treating the Northern Arizona population as at equal risk. In reality, there's a differential risk with a heterogeneous risk landscape. Can you model easing restrictions on the low-risk population components and on low-risk activities?
Hello, this is Joe. Thanks for the question. That is correct in that we're assuming that the pathogen has an equal ability to infect individuals across the landscape of Northern Arizona. We do have some heterogeneity built in terms of low density populations may be at less risk because the pathogen has a bit harder time spreading if there's lower contact rates between individuals. But we do have the ability to build in more advanced scenarios, like a gradual increase back to normal or back to business as usual. And so we're really interested in working with Dr. Peoples and Dr. Peoples' team to come up with scenarios that you are all considering, and we can try to customize our model to ask those pointed questions. But yes, we do need to really consider about, for instance, health disparities across the region and how that can influence spatial heterogeneity and risk.
Okay, thank you. And this is Chair Archuleta again. I'm going to actually combine kind of two questions in one here. This is again about modeling and projections. Can you see the elective surgeries that are going to be allowed now? What effect will that have on the PPE and also will the potentially impacting the availability of testing and PPE? And has that been considered in the models, or will that be modeled? And then can there be an evaluation of how a countywide election on August 4th with a few thousand people voting in person throughout the county affect the spread of the virus? Is there any modeling on that?
Hi, this is Joe, and then I'll quickly defer to Ricky, who has a better understanding of the hospital PPE situation. But in terms of modeling, we have not considered the impact of allowing for those elective surgeries. In terms of the impact of an election, it's quite difficult to understand something that fine scale, like a single event, how that might influence the spread of the virus, because you'd have to consider, first of all, how many infectious individuals might attend such an event, and how that would influence contact rates compared to now. And so I'll consider thinking about those kinds of questions as we move forward, but it is a really hard question just in general to answer. And so, Ricky, do you have a better understanding of PPE?
Thank you. This is Ricky. Since March 27th, when we've been looking at the hospital capacity, they've been telling us whether or not they are low on PPE. And that has gone up and down in regards to availability of all PPE, including face masks, N95 masks, and others. But I think more recently, in the last couple of weeks, they've been giving us actual numbers. But in terms of how the elective procedures will affect that, I could not answer that specifically. But again, it goes in and out of being low on PPE. And right now, FMC is saying they're about 4 to 14 days for most, like gowns as well as face masks. So I don't know the answer to that, and I think that's something that needs to be considered in how the hospitals will handle those elective procedures. I wish I could be more helpful.
Hi, Chair Archuleta, if I may. The governor's order shares that with the elective surgery starting back, that hospitals have to have enough PPE to be able to cover, of course, the COVID operations and the elective surgeries. It also has language in there specifying that there has to be enough COVID-19 tests available to test pre-op individuals for COVID. So it's pretty prescriptive in terms of what hospitals have to have in terms of capacity to be able to return to elective surgeries. Thank you.
Mm-hmm. Thank you. And then the last couple of questions before we wrap up. Someone says, thank you for all the great information. What should our concern and response be with COVID in Arizona's jails and prisons and its spillover into the community? Recent studies have included the COVID infection rate in jails and prisons, and it's raised a lot of concerns about how other models have underestimated the spread. Another recently published study estimates the infection rate in Arizona's prisons will be 99% in the study cited. Thank you. This is great work.
Ricky, do you want to handle that question?
No. So right now across the country, we're seeing extremely high infection rates in jails and prisons. There was an estimate in an Ohio jail that it was almost 75% infection rate. And I know that the jail here and as well as around the country have been taking those measures with releasing people. And that causes other problems with potential housing stability of these people, so that the problems might not be eliminated rather than moved to maybe homeless shelters. So I know that doesn't directly answer the question, but I think communication with Arizona jails and prisons is very much needed. And I know that there are coalitions working on this, and I can't speak personally to know this, but I, that there probably is more moving forward through the Criminal Justice Coordinating Council here in the county with possible answers to that question.
And this is Sam. It's such an important question, and some of the guidance that we tried to put together in this report is specific to correctional and detention facilities and justice involved individuals. And so we'll make sure we get that out to the public, so that way folks can make informed decisions about employees and the facilities and those individuals that are in jail. Yeah.
Chair Archuleta, I can also share, it does not apply to the nation, but on a Coconino County level, I can share that the Sheriff's Office, along with the Emergency Operations Center and Health and Human Services staff, have been incredibly proactive in monitoring the jail population. So we share lists of names daily, and we cross-reference and check those to see if any of the individuals that are in jail have tested positive. And so we're really being proactive in that manner. We're also being proactive in testing jail employees that could have had an exposure. So we're trying to monitor in that manner. And then the congregate settings, because of course it doesn't just relate to jails, but within shelters as well, there's a lot of precautions that are being taken within the shelters across Coconino County. And we've been a leader in that space as well, which gets to some of our isolation and quarantine operations. So again, doesn't apply for modeling across the state, but I can say that our efforts have definitely helped with it across the county. Thank you.
Thank you. And the last question, of which I'm going to combine three, is when will antibody tests become available? And then will future testing and cases demonstrate better demographic data? And then again, about the county's dashboard, is hospital availability information on the dashboard, including ventilator availability data, which the person writes that the ventilator availability data seems very off, and that needs some follow-up. So Marie, do you want to take those about when antibody tests will become available?
Hi, thank you. I wish I had an answer for that, Chair Archuleta, members of the board. As you know, we're still struggling with even having a consistent supply of regular specimen testing. So we've heard different things about antibody tests being available across the nation. I do know the local laboratory, TGen, has that capacity and availability to do it, but I don't have any information on about when it will be widespread. I wish I did. That's something we'll continue to check on because we're incredibly interested in it as well. Regarding the ventilator availability, so we get updates from the hospitals on that. I can share that through different federal pushes and different supply chains, ADHS has been providing ventilators, not in the quantities that are perhaps needed, but that is a priority and has been occurring. With the ventilator data, I'm not sure that I would agree that it's off. I would need to learn more about that. But what I can share is that when someone is on a ventilator, that's usually a long process. That ventilator is then not available for others to use. I mean, so we may have 10 ventilators, just throwing a number out, but those 10 ventilators are going to be in use for quite some time, and then we have to procure additional ventilators for individuals that may need them. So we will continue digging into that information and try to update it as much as we can on the website. I know these are top of mind for community members, and we want to try to share as much as we can. Thank you, Chair Archuleta.
Absolutely, and then with that, it would be will future testing and cases demonstrate better demographic data?
Yeah, absolutely. So our demographic data has improved each week, and the number of tests that we give is what really helps with the demographic data. It's hard to give robust demographic or zip code data with low numbers. And so as we test more individuals, we can share more out and have better sense of who is presenting with COVID. And again, as we have more testing ability and can start looking at testing asymptomatic individuals, that will help the demographic data as well. Thank you.
Great, thank you. Well, we've come up against our time that we have for this particular item, and so I'm going to close the questions now. And I just want to, on behalf of the Board of Supervisors, want to thank the entire NAU team. I want to thank the county team under the leadership of Dr. Peoples, the epidemiologist, the entire team for your collaboration on this incredible report. It is certainly going to inform our decisions as we move forward. It is valuable information not only for those of us in Coconino County, but for all decision makers across the state. And we we can't thank you enough for the time and effort that you've put in. And so I do want to acknowledge again who put in, who was the team, because I think it's very important that we acknowledge their hard work. And so doctors Camplin, Mihaljevic, Sabo. I also want to thank the other epidemiologist team members, Julianne Baldwin, Paul Klein, Crystal Hepp, Ek Dory, Bretiana O'Connor, Megan Warren, Emily Verbally, and all of the folks from Coconino County. Those were the NAU folks in particular, but then everyone on our epidemiology team at Coconino County and those in the EOC and who had a part in this. So with that, I'm going to end this particular discussion and this particular item. We're going to take a brief 3-minute recess, and then we will come back and return for the rest of our agenda. Thank you so much.
Thank you.
Well, thank you very much. We're going to end our recess and reconvene our meeting of the Board of Supervisors. Let me just check in and make sure that we have all of our supervisors here. Supervisor, Vice Chair Fowler, if you'll just let me know you're here.
This is Matt. I'm here, Liz.
Super. Thank you.
I'm here. I'm here, Liz. Thanks.
Perfect. And then Vice Chair Fowler. Yes, got you, Supervisor Park. Got you, Supervisor Babbitt. And I see the Vice Chair is on. She's just on mute. So, okay, well, we're going to go ahead and continue. Thank you very much for that discussion. We are now going to go to a discussion update, our roundtable, which includes discussion update and possible direction to staff regarding state and/or federal legislative or administrative matters. Public Affairs, Eric Peterson, go ahead.
Thank you, Madam Chair. I hope you can hear me. I'm getting my screen loaded up here, so we will get this added in for you.
We can hear you, yes.
Okay, good. So let me get this all up there. There we are. All right. So I'm going to send this live to you. This is what I want to go over today is CARES Act guidance. Hopefully you can see the screen here. I'll try to zoom in a little bit for you all. CARES Act guidance has come out. This was a great conversation we had in the LPC meeting earlier today with CSA. There will be an update that Julian is putting together from that. We're just waiting on the slides from CSA to send out with you, to you, I should say. But we also did add send out to you earlier this week the fund guidance for the CARES Act. So this is about the money that is allowed, the state could send to us or allow us to be a part of recovering costs under the CARES Act. This guidance has been posted. I think there's some notable things. I'm just going to scroll in through here. Again, I know this is probably smaller on your screen, but essentially, yes, public health expenses, things as we anticipated, not budgeted for, but related to responding to COVID-19, including getting our workforce up to speed to work from at home, costs for public health and safety measures, costs for family and paid sick leave can be added to that. Unemployment costs, if they're not reimbursed, can be added into the CARES functions. So this guidance is out. You have it in your email. We'll also have an update for you later today on the CARES Act. So I'm going to pause there and find out if there's any conversation about the CARES Act folks want to have. I know your day has been long and want to be brief for you.
Thanks, Eric. Any questions about the CARES Act? Okay, well, probably none at this time. I mean, we've been getting information all along, so we appreciate it.
Okay, so the next thing is, as you know, we have created a COVID-19 funding task force for the county that takes in the information of what's available, what have we applied for, what have we received, and then also our costs and expenses to provide a robust and a full sense of the response and the costs. The state has now created that same type of thing. They're calling it the Economic Recovery Management Team in the Office of Budget through the governor, a multidisciplinary team that is working on creating the points of contacts with the counties and local cities and such. Joanne Keene is our single point of contact for that group. So we'll be directing information to her and then obviously into our task force. What has been posted, and I sent this email, I just wanted to again provide it, is this page is incredibly important, this COVID-19 grant resources. What you see here is obviously staff are going to update this. This is the state side of it, not well yet fleshed out. But the federal information is fleshed out. And I will just pick one. Let's go to emergency management, criminal justice. So here are announcements from FEMA, whether it be from the CARES Act or other actions by the federal government, what's available from the federal side. The same with the Department of Justice here on different uses. And then again, the state will be updating any guidance they have on how to access those funds through its various departments as well. So this is an incredibly helpful website. Wanted to make sure you all had that in your toolbox of tools as we go about managing this response.
Any questions about that or about the team or task force that's been put together? Okay, go ahead.
And then, so now we'll get into the more political aspects of things that are happening. The point of this sheet right here is to point out what's happening with the state legislature. As you can see, earlier this week, they were going to adjourn sine die on May 1st. Then about a day later, they were going to have 3 weeks of hearings starting May 1st. Now that is called into question. Senator Lupe Contreras and his family are positive, have tested positive and announced it publicly for COVID-19, which puts everyone's legislative plans in limbo. Senators Boyer and Carter have also indicated they will only come back to vote for things related to COVID, and it will not return for regular legislation. So that would change, obviously, the balance of power within the Senate and could cause the minority party to be able to adjourn the legislature. So there are simply no good answers for you on what's going to happen at the state legislature. Todd and Supervisor Ryan and I had a quick conversation before the LPC was reaffirmed at the LPC meeting that there is, if you have the crystal ball of what's going to happen, it is, you are a very rich man in the state. There is no indication yet as to what will happen. It's probably going to be a little bit later than May 1st, obviously, we are thinking. And if anything does happen, there'll probably be some very non-controversial, easy bills. But there will need to be budget conversations at some point regarding the impacts of revenue from COVID-19. So that's where the state legislature is at.
Any questions on that? Okay, go ahead.
All right, and then federal actions. COVID 3.5, which is the bill that we have been hearing about in the Senate and the House, was signed by President Trump this morning. There is a small amount of money for testing to state and local localities. It's very vague in the bill, so we expect that money, if it's going to come to us, to flow to the state DHS and then down to local governments if it comes at all. I will make that very clear. It was $12 billion. Arizona will receive some portion of that, but I just want to make sure everyone's aware of that. That is in the law just signed by the president this morning. COVID 4.0, or the CARES 2 Act, as some people are calling it, negotiations are beginning. Democrats obviously very focused on an infrastructure, state and local funding type of bill, another large spending package to help the economy overcome the impact of this pandemic. President Trump tweeted this week, the following tweet that I posted here for you, that he wants to move on to that for fiscal relief for state and local governments for lost revenues, infrastructure, and lays those out. I have talked with Bob and Anna, and they are very clear that there is not yet a consensus of what infrastructure will be in a bill. Is this a bill that is focused on the things that the president has pointed out here? Is this broader public works involvement? Is there a very specific type of thing? Right now, everyone's just throwing the kitchen sink in. There is no direction from leadership on these are the kind of things we want to consider and these are not. And obviously, the Democrats are driving most of this bill. The below news is a little the disappointing news, where Senator McConnell is talking about actually raised an issue of allowing the states to go into bankruptcy. And this is a reaction that we heard in regards to state pension systems and why there was not a willingness to fund state and local governments. And so out of the pension systems, there are many across the country that are struggling, Illinois being a classic example. But Senator McConnell told Hugh Hewitt, and there's an article linked here, essentially that Republicans are not feeling desirous of bailing out state pensions. That is a reason why not to fund state and local governments, and then offered up the bankruptcy route rather than the federal government providing more. There's also a debt conversation happening from members of the Senate majority as well, some members, that we are exceeding what should be an allowable use of debt on the federal side in these spending packages. There has been some pushback. Senator McConnell is not unanimous with his caucus on this position, but it is indicative of the challenges moving CARES 2, COVID 4.0, whatever we wish to call it, forward. Is we're going to have to overcome some major hurdles in that regard. NACO, of course, is encouraging us to continue to do that as well, to continue to push so that we can overcome those hurdles. So that's where things are sort of heading with CARES 4, CARES 2, COVID 4.0. There are a couple smaller issues, which are important issues to us, that I did want to bring up. One is we have.
Sorry, Eric. This is. Yep. Hang on 1 second. This is Liz. So I'm trying to understand kind of the intersection of the pensions and the
The bill?
And another package.
Sure. So obviously we have pushed for direct fiscal relief, right? Here's a check, here's cash, revenue replacement and such. Essentially, big drivers of many budgets for states are the costs of money they must put out of their tax levies, whether it be income tax, sales tax, and such, into the pension systems. So any check for relief removes the political pressure and also just the need for the state budget to pay for a pension system cost. And that is for those folks who are not in favor of the pension systems. There are many in the Congress that don't like the idea of pensions. They would prefer 401k route and such, a defined contribution route, and view some of those pensions as being overly generous to employees. This is a way to reward states for, in their opinion, making bad fiscal decisions about pensions by bailing them out. So the nexus with the bankruptcy route is the states have to do some of these spendings, let them go to bankruptcy, and the bankruptcy court will begin to reform and solve those problems. And it should not be a federal tax burden. I'm trying to channel Senator McConnell, a federal tax burden to take care of those costs.
No, so I think maybe just gathering, if we continue to gather county information about, I mean, we're just talking about general operations. I mean, this is costing us upwards of $700,000 a month. And so this is not about pensions. This is about general operations in Coconino County.
Correct.
And response, and more importantly, response to the COVID.
Correct. That is correct. I don't think that there is any indication that local governments will get funding without the states, and that's where this nexus comes with state issues. But yes, we completely do that, and we'll continue to frame it that way. I just want you all to be aware of some of the challenges and words we're hearing.
Got it. Thank you.
Land and water conservation funding. The Mountain Pact has reached out to some. Supervisor Ryan, your office asked if this is something the board should consider. I'll share the actual letter here, but it is Mountain Pact is a group that supports obviously environmental concerns. Land and water conservation funding. They have had some signers onto this letter. I believe Supervisor Ryan, your office told me you were signing on individually, but I wanted to bring it to the board to see if this is something that all 5 of you wanted to be on. We certainly can email this. You don't have to spend all the time in roundtable, but we can discuss it here if you wish.
Just to add to that, basically what they're doing is they're putting their support. It's an intermountain region group of cities and towns that look at common issues, ecotourism, that kind of stuff. But they basically are, aligning with what we're doing, the Land and Water Conservation Fund, trying to get a full funding associated with it because it benefits them. So the question was asked if, I said I would sign on to what they're doing, but, the question was asked, would the board consider it? I said, we already put a letter in. We could just use that letter if we want to, but just to bring it to your attention.
So, yeah, I mean, this is Liz. I mean, I would love to see the Land and Water Conservation Fund funded. I mean, we did have that in our legislative package. So to the extent that, yes, I want to have it funded. I mean, are we going to have to prioritize what's funded? And I also want to see shovel-ready projects funded to put people back to work. I mean, all of that. And so, but I mean, yes, I mean, I personally would sign on to this if, if the entire board wanted to do it, that'd be great. If not, I personally would sign on to it.
Chair, this is Supervisor Babbitt. I'm right with you on that. It's long-standing supporting Land and Water Conservation Fund from the board, and some level of this is going to be a shotgun approach to shovel-ready projects plus opportunities, and this should be on the opportunity list from my perspective.
Okay, let's go ahead then. So I guess, let me hear now if there's no one, if there's a person that does not agree to us supporting this as a board. Okay, so silence indicates agreement. So we will move forward. Yes.
Madam Chair.
Yes, Supervisor Parks, go ahead.
I think I really am not able to make a decision just yet about this. I'd really kind of like to look at it a little more. Can we postpone a decision by the board for a little while?
What's the time frame to sign on?
Madam Chair, in the correspondence I had, there was no timeline given, so.
Correct.
Okay, so, right, so I think, I mean, Supervisor Parks, I mean, if you could let us know by, I would think Tuesday at next week, but the fact is that this is on our legislative agenda where we have been, you know, really advocating for this. So how about next Tuesday that we make a decision to move forward with this, or and then see if you're able to join us in that.
Okay, that would be fine. Thank you, Madam Chair.
Sure. In the meantime, go ahead and email us the letter, Eric.
Yes, will do.
Okay, thanks.
Yep. And then the other item, very similar, Madam Chair and members, that has come up is the request from NACO that we offer in request of the delegation support for a Dear Colleague letter for permanent and mandatory funding for the payment in lieu of taxes and the SRS programs, PILT and SRS. 6 members of our Arizona delegation have already signed on to this letter. Representative Grijalva, Biggs, and Lesko have not yet. Representative Grijalva generally does not sign on to letters about PILT and SRS as they go through the committee, but he has in the past at times. This may be one time where he is. Created one letter to the 3 that have not, asking them to, and then a very similar corresponding letter thanking the 6 that have signed on already for the chair's signature, and just wanted to bring them to your attention and see if there's any feedback or concerns before the chair would execute.
So, Eric, in terms of this letter for the SRS and PILT, is everybody fine with going forth with it? I mean, obviously, that's, again, been on our agenda for a long time. We want to encourage members of our congressional delegation to sign on to it. I'm prepared to sign this today. I'd like to get it out as soon as possible. They do need it quickly. So if I hear no opposition, being that this is on our legislative agenda, I'd like to move forth.
It's consistent with what we've put together for and have continued to put together to try and get funding from full funding from PILT, etc.
And I'm very supportive. This has to be on our agenda of priority. Thank you.
Okay, great. Thank you. Okay, go ahead, Eric.
Madam Chair, that is my roundtable update for you today. So if there's nothing more, we can move on to the manager's report, or if you have any questions, I'm happy to answer them.
Okay. Any questions in general for Eric?
Yeah, actually, if I could, Madam Chair.
Yeah.
And it might pop up during the manager's report. We just got a request today from Jeff Malbach with MetroPlan, FMPO. If we would, the city of Flagstaff's asking us to sign on to a letter to support their application for the build grant, once again, to try and get 4th Street widened. We've put in letters of support, I think, for 3 years now for them applying for that. It's pretty consistent with the priority items that have been part of MetroPlan from a regional transportation perspective. And so, you know, I don't see any harm or foul, but, you know, Art might want to weigh in on this.
Madam Chair, I have no issue or concern about the county supporting a build grant letter. It is patterned for the manager's signature, which is consistent with our past letters. And we do have a draft, and we'll just be cleaning it up here today, but happy to engage on that however you wish.
Okay. Great. Any further discussion about that? Okay, well, let's move forward to our report out from County Manager Jimmy Jane. Jimmy,
thank you, Madam
we
Chair.
can hear you.
Yeah, thank you. So, so just a closing on the letter. I did hear from both Supervisor Ryan, Supervisor Babbitt, and from Lucinda that they were okay with that. So, if Madam Chair, if there's no any issue, we can either bring it back next Tuesday, or we could go ahead and move forward as outlined by Supervisor Ryan on that letter. If nobody has any issue with that.
I'm fine with going forward.
Okay.
Yeah. Others, anybody with concerns?
I'm okay with it.
Okay, super.
Again,
Vice
thank
Chair
you.
Feller, you okay?
I'm supportive. Thank you.
Super. Thank you.
Thank you, Madam Chair. So an email will be going out later today. We briefly mentioned this on the EOLT call this morning, asking departments to kind of start working on a reentry plan to be sure that we are prepared as we walk through this space. We do not know what the timing of that is. So this is not hurrying anything. This is not saying, you know, we're going back to business May 1 or May 30. There's not a date to it. But just, again, working in partnership with the departments as we went into this very quickly. But as we exit it, we would exit this in a very thoughtful and logical manner, understanding there will be likely some changes even in how some departments do business moving forward. But again, what is the plan in bringing our team back into a more normal work environment and space? So again, there'll be an email going out from me later today to the organization to that effect, and we'll continue to pull that apart. We'll continue to pull that apart on the EOLT calls as we move forward. There will be a budget presentation, I think, as you all know, on Tuesday at 1:15. So materials are posted, and I've been visiting with you also individually. So I just encourage, if you have other questions on the material prior to Tuesday's presentation, to please let me know, and I'll be happy to address those or get those questions answered for you going into Tuesday. Madam Chair, we are looking at budget discussions. Again, the week of May 11th yet to be finalized, but really focusing largely on Tuesday the 12th and Wednesday the 13th. I believe that those are noted, should be noted on your calendars, and we'll be getting some more details out regarding the timing of it, but those are the 2 days that we're specifically focused on, is the 12th and 13th. Madam Chair, if I can, I did receive a call from Liza Nolan at Local First Arizona this morning. She's the Director of Rural Programs. After this call, I'll be sending you an email that outlines some information and background from Coconino County specifically. This is in relation to their mini grant program that they have, which is for businesses that are up to, these are the really small businesses. This is up to 3 people, you know, under 250,000 in gross annual revenues. They have so far to date given, and there'll be more detail in the information that I send you, but they've awarded 9 grants so far in our county for $15,500. They have a request, again, that just came in this morning to see if the county would be willing to partner on additional $20,000 to help support this effort. Again, I'm going to send you out the information. I've reached out to Chris and let him know that this was coming, and that we've had 107 total applications in the county so far, and again, 9 have been awarded. So I'll send this out. I know it's something that Supervisor Babbitt and Archuleta, Ryan, and others have been interested in and really involved in this space. So we may want to consider how we could potentially partner with Local First should we choose to do so, again, to support our very small businesses in the county. Madam Chair, members of the board, that's all I had today.
Great, thank you. Any questions for Jimmy? Okay, well then we're going to move on to our next item, and why don't we go to roundtable? Each of you have received an update from me. We spent some time, I spent some time with each of you this week, and so let's go on to Supervisor Babbitt. Would you like to go next?
Sure. Well, thank you, Madam Chair, and appreciate your guidance and perseverance getting through this today digitally with some hiccups, so thanks very much for that. Just a few things. Some of these are continuations of discussions that we've been having. A couple updates, I think, as you all saw. Unfortunately, I did not make it up to Mount Eldon for the kind of final cleanup of the on-forest work. I've been up there twice in the last couple of weeks, and would really encourage the board to get with Christopher or flood control folks to go look at the work that's been done with natural channel design, and that is essentially completed, at least the structural component. So that's a good, important deal. Homeowners up there understand it is the first important step in a multi-year process. So we feel super fortunate of that. Tiffany Construction, knocked this out, well in advance of what we were hoping for, which was before the start of the monsoon season. So really appreciate that. Did have a couple pieces of conversation that have going on with the town of Tucson regarding some broadband. I just sent out an email to Matt Fowler and Superintendent Lewis for some help on trying to get some kids connected in that space in Valley, and Matt Fowler got right back with me, so really appreciate the responsiveness. And what it shows is what we talked about at the proclamation this morning, that even though we are kind of 110 miles an hour on coronavirus stuff, we still are doing work, so that's really, really good. Did want to just make sure, I'm looking at the Q&A still from this morning, and want to make sure we have folks who are going to go in there and answer questions on that. I thought it was a great conversation. I think folks are really going to be interested in the antibody piece, because that will allow businesses to know who has had some higher level of resistance than others. I think that's important. And then finally, the last piece that I just want to bring back to our attention, got a very thorough report on some of our expenditures around our response. Jimmy and I have had several conversations on Hotel Aspen and utilization rates. I think we're going to have a whole bunch of short-term competing needs that we are going to try and balance. I really hope we are active and intentional about moving to a different model that still serves the same output there in a very vastly different fiscal approach. I look at our rent assistance and how overwhelmed and upside down we are on that, and I look at the resources that are being directed to, and they have increased substantially in terms of total budget. So how can we balance those better? I'm going to keep advocating that we look for a different way forward on that, immediately. I know we're all working hard, and I know there's no perfect answers with that, but I do think that's something we want to keep our eyes on very, very quickly, because the expenditure rate is really high. I also do want to better understand the last piece. Is there on the for the COVID piece on the governor's order, and how we can make sure we understand what labs are doing and why we are not getting that data, because it is one of the things that folks are so intensely and appropriately so focused on. There's got to be a way for us to have a better sense of the testing that has gone on here. So with that, appreciate everyone's work and efforts here, and I will sign off.
Thank you, Supervisor Babbitts. And yeah, I really appreciate, I think Tuesday having a discussion about the funding availability for the rental assistance, et cetera, is going to be really important. As we continue to move forward, it continues to be extremely important as we are having gaps in being able to fill needs, of course, and certainly calling upon our nonprofit entities to assist us as well is something that we're doing. And I know they're doing a lot of fundraising too, so definitely we need to speak about that. Why don't we go to Matt Ryan, District 3.
Oh, there you go. I have it off already. Nice. So just quickly, I think we've come to the end of our governor calls so far. I mean, up until an indefinite time, unless something springs up. However, the note during CSA was that they will still accept our questions, anything that we have, which was something they were beginning to establish before. So just a heads up on that. You know, as I don't know if you noted it in your thing, Liz, you probably did, but I've lost track. With General McGuire coming in on Monday, you know, that'll be, you know, important as it relates to our different facilities. You know, it might be an opportunity, I'm not sure if it will be that day, but maybe, to ask about the potential transition of populations from Hotel Aspen into the acute care piece. You know, what is their position? No matter what, you guys are going to have a meeting, so you can push that issue further and see where we end up. And yeah, I too am curious about the numbers on what's happening. I think we all are. And so that's an important piece. I've been working. Well, actually, community cleanups are coming up pretty soon. The vouchers for the western part of the county should be happening pretty soon. So I usually align a letter that goes out to the community and am adapting it a little bit to provide additional COVID information. But that's what Greg and I are, you know, up late working on at this point. We have to get them out to print to match up the timing associated with it. You know, no matter what, we've been trying to push our information out to the communities, and there's always something new every day. I'm looking for a day that I don't have phone calls all day long, but by the same token, they are important calls. I'm going to keep it short at that.
Thank you, Supervisor Ryan. Let's go to District 4, Supervisor Parks.
Okay, thank you, Madam Chair. I just have a couple of things. We were able to deliver the ambulance donated by Forest Lakes Fire Department and the community there. Many thanks to those folks for donating this ambulance to Navajo Nation. We delivered it to Sacred Mountain Medical on Tuesday, and they are going to have it. They're going to have new decals put on, the old ones taken off. They are going to have it outfitted and the radios redone, and they should have it back in operation shortly, within a couple of weeks. And that is a real positive for them, and we feel pretty good about it. And again, many thanks to Forest Lakes and Chief Dave Rodriguez for the gift of this ambulance to Navajo Nation. I have one problem in my district that is starting to loom up bigger and bigger here with the COVID closures, and that is Grand Falls. We're having a real problem in the Loop chapter with the off Navajo Nation folks going to Grand Falls. It seems to be increasing because the folks are off work and maybe they just don't have enough to do around their home, and they are showing up out there at the falls. Grand Falls is closed. It's been closed ever since March, and people continue to show up out there and try to get in to see the falls, and they do, because there's nothing there to stop them. I took some signs out there about a month ago, road closed signs. We tried to close off the road. People just drive around the signs. There's a complete lack of respect for the Navajo people in that area. That's their home. That's not public land. That's their home. They have livestock. They have children. They have dogs. They have just their home life in general being disrupted by people driving out there with total disregard for either speed limits of any kind or the fact that the road has signs that it's closed. They just drive around them. I realize that it's an enforcement issue. However, I've talked to Jim Driscoll about it, Sheriff Driscoll. They can't do anything about that. It's on Navajo land. It's not county. So that leaves it up to Navajo Nation Police, and those folks are spread so thin and they're so busy right now that they can't possibly even think about sparing a unit to go out there and police that road. So we've got to do something. I had a conversation with our councilman yesterday, Thomas Walker. He's going to take it to the Navajo Nation Council, and we're going to have to do something. And we are considering having Loop chapter actually set up a toll area and charge for folks going into Grand Falls, so that we can have someone there that is being paid to both do maintenance on the park there, pick up the trash, and kind of police the park. That being said, I'll continue to talk to folks about this, and we'll try to come up with a solution, and I'll keep you all informed. Last thing is, I agree with Supervisor Babbitt on both the Hotel Aspen spending and also the rental and utility assistance. Both need serious examination and or overhaul, and the rental and utility assistance is a deepening chasm, and it's not going to do us any good to continue down that road because we just don't have the money to do it. Hotel Aspen piece is badly in need of renegotiation at the least. I would be for abandoning the single hotel contract and starting over and utilizing several of the hotels in town, or if not, possibly all of them for this. But it should be done on a case-by-case basis and not a blanket contract that wastes 112 to 114 rooms a night under a rental agreement that we pay $190,000 a month for, and that doesn't even include the cleaning. If someone stays in a room, it still has to be disinfected, so that costs extra. So I think that we do need to re-examine that. We need to do it really badly, and with that, I'll sign off. Thank you.
Thank you, Supervisor Parks. District 5, Supervisor Fowler.
Hey, that is District 5 right there. All right. That's where I want to go. So I see the photo on our screen there. That's the road to Lee's Ferry. So thank you, Madam Chair.
So my report, it's been it's just amazing how much more work you end up doing from the time you wake up to the time you go to bed, because you're on a phone call and all kinds of meetings going on. It's been very, very busy, but very good busy. And today we just delivered 55 beds to Tuba City Regional Healthcare Corporation. 35 of it for the hospital for the overflow that they just now are setting up, and they turned their wellness center into into a overflow unit, and so I guess they finally delivered that. 20 of those beds are going to go to homes. We're working with the public health on that. We had 2,000 masks that was delivered last week, and that was distributed. Tuba City, let me back up. Tuba City Chapter is a sub-office of the Navajo Nation Command Center for the Western Navajo Agency. So that's how they're working, is all the things that are brought in then is reported to Navajo Nation Command Center directly. We did a hate crime form, and that went really well. It was pretty interesting. I want to thank Eric and our county manager and Jimmy for information, and it was well received. And there's going to be a follow-up series, I believe, that they're going to do. And so it was actually very good. On Monday, Supervisor Archuleta and I are doing a homeless forum or presentation with a number of our partners to the Western Agency Council, and it was requested by Speaker Seth Damon. So we're doing that on Monday. We met with the St. Mary's Food Bank, and we learned that there's two operations going on. There's the Navajo Nation President's operation, which is the Health Command, and then the Speaker has something on their own too. So the St. Mary's Food Bank is working to deliver food to each of the chapters, and that's what they're working on. Last night I was able to connect with the Federal Region 8 Disaster Mortuary Operational Response Team, and they're going to come out and meet with our local mortuary and help Michael out over there. So we're able to make those connections. So we're pretty busy in trying to help just the situation that we're in on Navajo, and then also in the Page and the other regions. We asked the St. Mary's, all the locations where they deliver, and for a schedule, time and place throughout Coconino County, so that we can maybe have, we as supervisors, we can get it out into our communities. So they're working on that with Esler and Lucinda. Yeah, they've been really working hard on that. I've been calling and meeting with the businesses in my community, in my district, and trying to find out who has received the business the grant and who hasn't. And so, and then the Chamber of Commerce and Page is also doing that. Really appreciate Chris, our Economic Development Manager, and Cindy Wilson. We've been, we had our phone presentation, and that went really well. Now on Wednesday, we're going to start doing Facebook Live, because there's so many questions on unemployment, and then self-employed business people or independent contractors. These are really small business, micro businesses that don't even have employees. So we're concentrating on them, and so we decided, okay, since we have so many questions coming in, we will start doing presentations on those. A lot of questions come in on the taxes as well. Do we have taxes that are people wanting to know, okay, we're supposed to go online and, or if I don't have my account with IRS, then how do I get my tax, or how do I get the stimulus dollars? So a lot of questions around that area. So we've been trying to get that information, and our position is if one is asking that question, how many others are there? So it's easier to just answer questions all at once on a Facebook Live. So of course, I'm still meeting with Western Agency Council. Navajo Nation President has its meetings, and then Speaker has their meetings. So there's a lot of meetings on Navajo that are taking place. I want to appreciate the last meeting we had with the Western Agency Council. We had FMC on the line, and Mark Carroll was able to facilitate a discussion, and the Winslow Health was on there, and Little Colorado River Hospital, and Page Banner Health and Tuba Regional were on there. So I just want to appreciate them for coming in, and then just want to thank all of you for everything that you're doing. Keep yourselves safe and remember to drink water. It's a beautiful day outside, I found out. So anyway, thank you so much. Really appreciate all of you.
Thank you very much. We appreciate all of the reports and all the work that each of you are doing out there. In terms of a District 2 report, we are continuing to work on the census, and in the newsletters that you send out and in the meetings that, you know, that any communications that you're sending out or opportunities that you have, it would be great if you can continue to encourage people to fill out their census forms. I mean, by now, if people haven't filled it out by phone or by the web, they're likely going to receive a census form in the mail. But, you know, those are not all out yet, and we want to try to get as many people to complete their census forms via the web and the phone. Because, as you know, sometimes mail piles up and things get, people intend to go back and do that, and then it sometimes doesn't happen. So if you would just please continue to push the census. I mean, some of the deadlines, of course, have been pushed out because there's not, you know, there's the inability to have enumerators, you know, on the ground and going door to door, as it was, as you know, the number of enumerators was being decreased anyways, but even more so now with the virus, enumerators are not on the ground yet. So if you would please help your constituents remember the census and to do that, that would be great. I just want to bring up that although the executive order of the governor's office prevents eviction for people who are renting and can't pay their rent that have been affected by COVID, landlords are still able, according to this is in their contract, to charge late fees, and they are still able to go through the eviction process and go to the court to request eviction and even to get a judgment of eviction or a writ. But what happens is that at the county level, we are not able to, according to the executive order, we are not delivering those writs, right? So that's where people are not being evicted, is that the constable or the sheriff's office, if they're the ones that are being used to deliver that, we are not delivering those. However, I'm hearing from community members that landlords are threatening them with eviction. They are a lot of the tenants are feeling very troubled because they feel like they're being harassed by landlords, and that they really are scared and would like some intervention. And you know, we're not at the county, when we help people with the emergency assistance, we are not able to use that money for late fees. So we do not pay late fees. So any request that a person has for some emergency assistance for rental assistance cannot include late fees. But you know, if a contract is written where a tenant is accumulating late fees, you know, let's say at $10 per day or greater, the executive order does help the person to stay in the home, but then all these late fees could be accumulating and they'd be in a worse financial position later on. And so there's, I mean, obviously there's some, you know, complexities around this, but I'm just bringing this up to you because Mayor Evans had sent me an email about this and wondering what the county could do in terms of maybe making a statement to the landlords or providing a letter to landlords, you know, asking them to continue to be patient and to work with tenants, you know, as much as possible, and, you know, even asking landlords to not assess late fees. And so just want to bring that up to you. And we have not, I have not made a statement like that or put together anything from the county on that. I did inquire with community services to see how prevalent that was. And I know that Michelle said that, yes, there are some landlords that are doing that, the tenants are reporting. So just wanted to put that out there. I mean, there probably is a space for us to have a letter written, again, just asking people to be patient. I know everyone is being impacted financially, including landlords, but again, just appealing to them from a more of a humanitarian point of view. So that is there. And then I wanted to talk to you about General McGuire's visit. We do have confirmation that he will arrive at 9 o'clock on Monday, and so he will be here from probably 9 to around noon, and we will have Aaron from Jimmy's office will be sending everyone the itinerary, and we'll let you know when is your time to arrive. Okay, and so each of you know about this. I spoke to you about this if you want it to be included in that itinerary, and so that will come out to you today, that final itinerary that's now been confirmed as of about an hour ago. Let's see, any other questions of me or that you might have, or of each other? Okay. Let me see. I'm sorry, my screen just went blank with our agenda. So if somebody could help me with that, I'm having my screen just decided to do a reboot. So on my other computer, can you help me with that, Eric?
Your report and the chair's report, and then we adjourn.
Okay, super. So is there anything else for the good of the order? Okay, then we will meet again on Tuesday, and thank you to everyone. Oh, I will say this. We are going to have a team meeting. Jimmy, Joanne, myself, Eric, Lindsay, and Matt Fowler from IT. We're going to just have a huddle at 3 o'clock today to talk about technology and see if we can figure out how to make our technology smoother. So appreciate your patience today. Apologize for the technical glitches, and have a good weekend. Thank you. Meeting is adjourned.